PPE. Ultimately, patient B2.1 died on day 28. 3 days after the funeral, A1.1 attended a birthday party with 9 other members of family A. 7 party attendees then developed symptoms of COVID-19. 3 were confirmed to have COVID-19, and 4 others were diagnosed with probable COVID-19. Patients A2.1 and A2.2 were hospitalized and ultimately died. 1 family member and a home care professional developed probable COVID-19 after providing personal care for A2.1 without using PPE. Patient A3.1 likely spread the disease to patient A4.1.
telephonic meeting scheduled for Tuesday, July 28, 2020 at 6:30 p.m. City Secretary Acosta, would you please conduct roll call?
Yes, sir. Mayor Bruno Lozano.
Present.
Councilwoman Diana V. Salgado.
Here.
Councilman Roland Garza. Councilman Raul C. Ojeda. Councilman Alfredo Carranza Jr.
Here.
Councilman James Jerus.
Here.
Councilwoman Elizabeth Elizalde de Calderon.
Present.
One more time for Councilman Raul C. Ojeda. Mayor, you do have a quorum.
Thank you. And again, because we're all now just for telephonic video conference means, I will be conducting the votes randomly for each council person, and I'll call upon you individually just because of the logistics behind it. So we'll now proceed on to the public hearing. I'm going to go out of order because public hearings do need to take place when they're posted for their time. And so we will now go on to item 4A, conduct a public hearing and consider a request for zoning change appeal number 20-03 by Christopher Michael Perez, who is requesting a zoning change from industrial to residential single-family district. Property description lots 19-21 Chico Edition, 110, 112, 114 Corona Street. Is there anybody from the public that would like to speak on this zoning change at this time? Okay, I hear nobody from the public. We'll go ahead and close the public portion of this hearing. We'll now open up the ordinance 2020-091, an ordinance in accordance with the Del Rio City Charter and state law providing for the rezoning of 110, 112, 114 Corona Street from industrial district to residential single-family district, RS, within the city of Del Rio, Texas. Is there a motion?
So move.
Is there a second?
I'll second, Mayor.
We have a motion and a second. Council, are there any questions at this time? Councilwoman Salgado?
Yes, I wanted to find out exactly what the situation was there. Is any of this property in the area that floods? I know that there's quite an area out there. I couldn't quite identify exactly where the property was located. So that was one of my concerns because of the drainage that runs through the park, across the street, and on through quite a bit of the property out there.
Hi, good evening, Mayor and Council. Janice Pokrant, City Planner. There is property that floods, but it's not on this street itself. It's further towards St. Joseph Street that has a flooding problem. We have not heard of any issues with flooding in this area.
Okay, now my other question has to do with being that this property has been industrial for many years, and I know that they have about 5 homes on, I believe it's St. Joseph, that were built not too long ago. How is this going to affect the industrial properties when one of those owners wants to do run an industrial type business from there? Because I know that usually when something like that happens, the neighbors are up in arms because you've got large trucks going in and out. So I just want to know what the city's intention is with the rest of those properties.
We don't have a plan to do a city-initiated zoning case on the rest of the street, although the rest of the street is developed with residential single-family houses. I believe that at one point when the city annexed this area in, they thought this would be a prime location for industrial uses. There used to be a number of industrial uses on the road itself, and it seems to have died down at this point. We've seen more small residential lots being developed in this area over the last 10, 15 years.
Okay, but that didn't quite answer my question. If somebody were to come tomorrow, someone who owns industrial property in there and wants to build an industrial building there for, for his industrial type business, how is the city going to to receive that? What are the city's intentions? I mean, is he going to be granted his or her permit to put an industrial type business there?
We would have to. If the property is zoned industrial, then they have every right to build an industrial type use on that property.
Okay, I just want to make sure that the folks that are requesting, zoning changes from industrial to residential are well aware, and if they sell these properties, hopefully the new owners will be well aware that there is industrial property there and that this could happen.
Yes, ma'am. And the owner of the property is on the phone as well. He is taking over the property from I believe his grandparents. It's been family property, and they're using the other 2 lots as backyard right now, and they have the house there.
Okay, well, I just want to be sure that everybody's clear on it. Thank you, Janice.
Thank you.
That's all I had on that, Mayor.
Thank you, Councilman Salgado. Councilman Carranza, any questions or comments regarding the ordinance?
No, I have none.
Councilman DeRuz?
No questions.
Councilwoman Elizalde de Calderon?
I have none, sir.
Please note that Councilman Ojeda signed on at 6:35. Councilman Ojeda, do you have any questions regarding ordinance 2020-091?
No, I have none.
Thank you, Councilman Ojeda. We'll go ahead and take a vote. I have no additional comments. All those in favor, I vote in favor. Councilwoman Salgado, in favor or opposed?
In favor?
Councilman Carranza, in favor or opposed?
In favor.
Councilman DeRuz?
In favor.
Councilwoman Elizalde de Calderon?
In favor?
Councilman Ojeda?
In favor.
Okay, the motion does carry. We'll now proceed on to item 3A, the city and public announcements, a briefing update on COVID-19 and review the amending the city's emergency declaration ordinance. I believe city manager will open up this discussion and information update.
Yes, good evening, Mayor and Council. I want to start off again just thanking all the city staff. They've been really adaptive, responsive to the ongoing changes, and continue to provide the essential services throughout the city. Our water treatment distribution continues, wastewater treatment, natural gas service, trash and recycling continues through Red River contract. Our police, fire, 911 services continue 24/7, and our transportation services continue as well. As far as an update on specific areas of nutrition services, our senior home delivered lunches, we had 8 more clients served this week, or compared to the last report. So we have a total of 595 receiving home delivered lunches. Please call to find out about that at 830-774-8670 to sign up. There's still currently 5 staff from the Civic Center that are helping deliver those meals. And the age limit for that is 55 and up. Our state-funded WIC, Women, Infants, and Children program, each month is a new month, and here at the end of July, we have 1,813 clients receiving those benefits. To see if you're eligible for that or qualified, you can call 830-774-8609. In addition, our WIC employees have sewn many cloth masks. The last report was 956, and that remains. However, they did cut an additional 445 new masks, so they can start sewing those soon. A reminder, there is no online convenience fee at all for our utility customers or property tax payments. For utility and tax payments, you can call 866-299-3771 to make phone payments over the phone, And for municipal court fine payments, you can make payments over the phone at 866-282-1248. Our public media has shared 66 informative posts related to COVID over the past 2 weeks. They share the testing graphic and other informative posts related to COVID. And we do have a dedicated webpage as well on our website. We did purchase many cloth masks, and we're distributing those to the public through the following means: to our transportation clients and their households. to our WIC clients and their households, to those, our clients in the senior meal program and their households. If you come to City Hall through the drive-through for utility payments, you can ask for some for your household there as well. These are free, no charge. In addition, we partnered with our county and given several free masks to them, to the commissioners, to give out at their food distribution events. So those that are attending those events are also can receive some free cloth masks at those. And we did give some directly to the housing authority to distribute to their residents as well. I might add the city, we do have an ILA or interlocal agreement with Val Verde County for 8 contact tracers for 2 registered nurses and an administrative assistant to help support the local authority and their efforts. And also we're ready and available to assist the county with delivery of food. And we do have our ongoing EOC hotline for questions, all things COVID related. I do have an update regarding funding. We do have 2 main sources for reimbursement for COVID related expenses that are eligible. We had been talking a lot about the CARES Act. That is one avenue. The other avenue is a FEMA PA or public assistant grant funding. Now the FEMA grant has no limit. The deadline for that is 30 days after the event is over, and this event is a COVID situation. This grant will pay for 75% of the expenses, and the CARES Act can be used for the remaining 25%. So the main areas and the amounts that we've spent thus far for the FEMA grant is in the medical side, the refrigerated truck, approximately $11,000. Our public health supplies, these are masks, disinfectant, sanitizer, thermometers, touchless dispensers, and plexiglass. Currently, we've spent almost $134,000. For this grant, we can use payroll for reassigned or temporary positions. Currently, our estimate is at about $81,000, and we project an additional $258,000. Some areas that are reassigned or new or temporary positions are those positions that I mentioned with the county and the LHA, the contact tracers, the 2 RNs and admin assistant. For temporary positions, these are admin help for the emergency management coordinator, health screeners at City Hall in the annex building, and an intern that's been helping Ori with the small business grant program. And the reassigned employees are those that are working primarily out of the EOC call center and the Civic Center employees as well that have been reassigned to assisted nutrition. Now we go to the CARES Act funding. We know we are allowed up to a little over $1.9 million. And it does have a December 30th deadline, and we can use this funding to be the 25% match for the FEMA. Our projected estimate for that 25% currently is $142,000. On the payroll side, for the CARES grant, which is primarily for budgeted positions, is our current estimate is roughly $486,000. We have an additional projected of about the same amount. And some of the positions that would be eligible in this are the emergency management coordinator, the public media team. They haven't been reassigned, but most of their duties have been COVID related, and sharing those, and our police park patrol. Again, they weren't reassigned, but their duties have shifted to enforce the declaration more than what they normally would do. And there's 2 other portions in the CARES Act funding. The next area is technology and compliance, and currently we've spent about $29,000, and we project an additional $174,000. Some of the examples here are the technology that we use to help us be able to work from home or at a distance. So, for example, the GoToMeeting, additional laptops for employees, the Encode software that we use, moving that to the cloud so more employees can work from home that utilize Encode. And the last program is a small business program. Currently, we've already allocated $100,000, and we project spending that additional $100,000 that was granted to support our local businesses. So for FEMA, that total is about 403,000, and the CARES Act, we're up to roughly 1.5. This is current and projected. And I think that's all I have to conclude my portion of this report.
Before we continue, media, would you please identify caller number 5?
Yeah, it's Roland, Mayor.
Okay. Thank you, Councilman Garza. City Secretary Acosta, please note the time that Councilman Garza joined the meeting. We'll now proceed on to the next portion of this update. I believe it's Mr. John Sheedy.
Sorry, I think we're ready here. Yeah, so good evening, Mayor Lozano, City Council, staff, Manager Winowski, and citizens. We'll continue our ongoing updates as far as our activities over here at the Emergency Operations Center and kind of what we've been involved in. So I think the first thing we want to talk about, of course, we always kind of compare. We go back to our last meeting. The last meeting we made a presentation on was July 14th, and so we're going to kind of compare the data. You know, we can see here really quick, we can see the tests that were submitted. You know, we went from 5,995 to 8,087. So of course we had an increase of a little over 2,000 tests. That was a 34% increase on our tests. We look at our pending, and we had 508 in July, and we've gone down to 462. So that's a decrease of about 46. That's a 9%. Decrease, which that's what we want to see on pending. We want to see that number. That means that we have less cases out. So we're doing really good there. Of course, the next one is the one that, you know, the positive, and we all know this is not good. And on July 14th, we stood at 729 cases. Currently today, we were at 1,344. So of course that's over 600 cases, and you know, it's about an 85% increase on our positives. On our recovered, you know, we had 141, and we're up to 593. And I think this is the one that's really phenomenal. They've been working really hard. I know the county contact tracers and the local health authority, and we were kind of slow getting started here just because there were so many cases coming in, and it was taking them time to get you know, their game lined up, but they're certainly getting more efficient, and we're starting to click through those really good. So that's about a 320% increase, and so that's really phenomenal. So, you know, kudos to those folks that have been accomplishing that. The next thing we look at are of course our active cases, and you know, we had 588. And we're at 751. And while, of course, it's an increase because we've had a lot of cases, it's only a 27% increase. So most of those other numbers are going to, you know, they're being recovered. So that's a good number as well. Our negatives, you know, we increased about 1,480, a little over 1,480. So that's about 31% increase. So about what we expected. Of course, the one that we've always all been dreading is our deaths, and on the 14th we were still sitting at 6. There's some debate. I know we're trying to, you know, with all respect, and we don't want to get ahead of anybody, and so we're still reporting, you know, definitively what's been confirmed is 22. Although I believe that the number is 41 or 43. Of course, 22 is a 16 increase, which is over 250%. And if we're looking at 41, I mean, that's a lot. And we have to remember this is in a fairly short period of time. So it's just very alarming. There's no way around it. This is just a real quick overview as we look at some of our graphs, and we show this one just to show because we started kind of, I worked over the weekend and kind of started trying to characterize this thing for us all moving forward, how we can kind of compartmentalize and think about COVID-19 in Del Rio and Val Verde County. And so it started off, we had our first case, I believe it was on the 26th. And you know, we had a slow, we creeped up to about a month later to 13. And then we sat for almost exactly a month at 13. We didn't even get one single case. So we kind of think of the first, when we started was phase 1, the phase where we sat at 13 for a month. We kind of think about that, maybe like phase 2. Then we had phase 3, which started, I don't have the date in front of me, but we started picking up twos and fews, never more than 5. And we did that for almost exactly a month. And then, of course, we started, I believe it was about the 25th of June, or I don't have that on me now, but when we started getting into double digits. So we're certainly in the double digit phase right now. Good news is possibly we're at the end of a month and holding the way, the projections have been, or at least what our experience has been rather. Maybe it's time for us to start going back down again. At least we're all very hopeful. And there's some very, very preliminary data I would suggest, and certainly that would be a question for local health authority and those folks to confirm more accurately. But it looks like there's a little bit of encouraging data that maybe that's going to be the case. But anyway, that's just kind of an overall graph of when we started and where we are today up to date. This is a little more interesting as far as it's just more compacted, and it's showing just for a month. It's showing the last 30 days. And so what this shows us is our of our 1,344 cases, 1,173 of those occurred in the last 30 days. So of course, there it is. That's where all of our cases, all except 171, have come from, and all within the last 30 days. This is something, it's too small to read, but we've been working. We've tried for the last few weeks to kind of put out most of our graphs, our data graphs. We have quite a few graphs we're working on, and we try to put those out on Friday. In addition, we have our daily graphic that's more just kind of to the point and not as detailed. And we certainly know that these graphs aren't for everyone. But for those folks, those individuals that may want to look a little bit deeper into the data and what it's doing, we're going to continue to work really hard to try and present this in that capacity. I know we've met with the mayor, and I know Judge Owens has been very encouraging and wanting to get more demographical data, more data as far as what's going on. And we've had a meeting. A really good meeting. We've all spoken about that, the city and the county. And so it looks like we're going to work on trying to collect the data and present the data from a more unified position. Of course, we'll share that with everyone. But we're hoping, I know the judge is also working with the local health authority and to try and get more information so that we'll have more data, different types of data to share, things like ages and gender and possibly age if someone passed away. There's just a lot of data that we're working on getting, and everybody's working really hard to get that. So we hope to have more graphs like this that will be kind of help us keep things, show them where they are. Of all the things that we looked at, and we went back, and one of the things that we know that's very easy to do is just go back and pull out, compare your positives against your results. And so we have to pull out all of our pending and retests, and we have to pull out inconclusive. But if we do that, we can get kind of what our positive infection rate is. And this is showing on Monday, 7/20. And we remember, if we look at this, we are showing the top line up there is showing we're at 15.39% of all the people who have tested. 15.39%, all the results that have come back, that is 15.39% have been positive. And then that was a 0.59 increase of the day before, which we don't see. If you go up to Tuesday, you move up one click, and you'll see we had again a slight increase. Now we're testing positive at 15.74%, which was an increase of 0.35 of the period before, and so forth. You can see 16.15 on Wednesday, which was an increase of 0.41. You can see 16.60 and 0.45 increase on Thursday. And then, of course, on Friday, we had 16.85%, positive for ratio for accurate for valid tests, and that was a 0.25%. The thing that's really alarming, and we've had a lot of people in the community, and I know that have offered different suggestions and looking at things, and that we've spoken to that have had ideas to try and graph different things. I know that this is one that a couple of people had talked about previously, and we kind of struggle because we want to make sure and go back and get this as accurate as possible. There's a couple variables that we still need to work through. However, it does speak a lot. And what this does, this is only going back for a week. So what we've done is we've taken July 20th, and rather than go back and pick up all of those weeks, all of, since the beginning when we were hardly having any positives, this is only looking at more recent data. So of course, this is more the reality of where we are right now. And it's kind of alarming when you look at it, because we go back a week and we can see that if we look at all of our tests versus all of our positives, and again, this doesn't consider any pendings or anything else, on the 20th, going back a week, we were actually at 27.20%. And of course, by the time you get to the 22nd, we're actually at 30.03% of folks in the last week that have tested with returns. 30% have come back positive. And then there's been a slight decrease on the 23rd. And then of course we had a little bit of an increase on the 24th. So this is something that we're also going to present this. We're going to continue to refine this. We need to try and work with some folks to try and find the best. How far do we go back? Is it best to go back a week? Maybe we go back 2 weeks. We're still looking at this, but this does speak volumes. I mean, it is what it is. But we're going to go back and see if we can continue to refine this and try and make it as accurate as we can. We are also going to include this in our daily graphic, where we include, of course, on our daily graphic, we're including, this is the number typically that we show. We show either an up arrow if it's increased or a down arrow if it's decreased. And we're going to show this one right next to it. So typically what you'll be looking at is you'll be looking at cumulative percentages, which are the entire event since March 26th. And then we'll be looking at just the more recent to show kind of what's happening currently. So anyway, it's something that we're going to pay attention to and continue to refine. This is just a really, I just wanted to kind of focus on when we look back up here in the upper left-hand corner, we can see on July 14th, we were only at 19% recovered, and we had 81% active. And today, even though there's been a lot more cases, they've actually moved that needle quite a bit, because as opposed to 19% recovered, we actually have 44% recovered. And so they're just doing a phenomenal job on those recoveries. This is just a representation of what that looks like. If you look at all of our active, if we come over here, you can see the blue bar would have been for the 14th, and the orange bar would have been for today. And you can see that there's been a 28% increase in active, and there's been over here on the far right, there's been an 84%, as we talked about earlier, there's an 84% in actual cases. We know that, but the thing that's impressive is here in the middle, there's been 321% in recovered. So that's just really, really looks good. And we talked about really quick kind of the new graphic that we're working on. We're working on with the county and in conjunction with the local health authority and everyone that can help us put this together. It's going to take a team effort for us to get this where we want it. But this is what Anita and I sat today, and Anita worked really hard and to look at the, kind of the, to put the image together. And I think it's looking really, really good. We've just started. I mean, we kind of slammed through some stuff for a couple hours on this. You can see some of the things we've talked about here that we've already spoken about: the positivity rate for cumulative, the positivity rate for current, our active cases. We're going to have a couple other minor, small graphs in here. We don't want that. We want this to be really at a glance. We don't want this to be too detailed. We want folks to be able to look at it and get a lot, take as much as possible from it. So this is the new graphic that we're working on. And again, once we can get more data, we really hope that we're going to be able to include, like some of the other communities have done, a little more information. We're going to keep information on our status of our hospital. So we're pretty excited about this, and we hope that everyone will find this useful. And we certainly, again, we appreciate any input. We always take input from community members. We get some really good stuff from folks that have suggestions. So please continue to put those forth if you have any. I think the last thing that I wanted to just talk about really quickly was let me see if I can get off this. Sorry, I think I'm back. The last couple things we want to talk about is we're working with the local health authority and to try and get, we were actually able to get over 1,000 swabs here at the EOC in cold storage. And these swab kits will be used for, we have 500 to use for either our community, however we best determine we need those. We definitely want to have some kind of available for our first responders. There's a lot of unusual kind of circumstances that occur every now and then when possibly we're going to be able to swab here and get those out to a lab really quickly. So we certainly intend on using those 500 swabs for our community and our first responders and kind of prioritize their usage. And then we also were able to obtain 550 for hopefully our nursing homes, and we need to kind of work through how we're gonna go about that process. The other thing, really quickly, we have a National Guard sergeant here. She's been wonderful. She's been with us today. She'll be here for all week. We had requested kind of some help on our temporary mortuary situation, and I can tell you right now, everybody is kind of looking at Valverde County and Del Rio because we really got in front of this, and other people are now trying to put these pieces together. Of course, we're all very hopeful that we're not going to ever need it, and that would be ideal. But we do have some capacity now. I know the hospital feels much more comfortable because they had already kind of pushed it to the limit. And hopefully with the sergeant that's going to be able to work through these protocols and procedures with us, because as you understand, it's very there's a lot of things that go into that kind of responsibility. But we hope that we're going to have that. She's with us this week. We'll have that Thursday, and then if the event arises, Del Rio will be in good shape. We had I know both the county, EMC, and myself were on a state call, regional and state call with some of the mortuaries, and it was a really good conversation to talk about kind of the ongoing concerns there, and it was very helpful. So other than that, that's all I have for my report. Thank you.
Thank you, Mr. Sheedy. And I believe we also have the local health authority, Dr. Gutierrez, on the line. Dr. Gutierrez?
Hello.
I believe caller's sick. There you go.
Hello. Okay, I'm
Hello,
sorry.
sir.
Okay. How are y'all doing? So I'm sorry, just been a little busy over here at the hospital. Of course, everybody knows about our numbers through the roof, and no end in sight. Unfortunately, I'm hopeful, and I wouldn't say confident. I'm hoping that we can at least come to a point where we can make that steep on our spike to go so steeply. It's incredible. And I know people will say, well, the more you swab, the more positive you're going to get, right? Well, that's true. That is in fact a true statement. But I don't think people should get so worked up about the actual total numbers. It's what's going on behind the scenes. I'm here at the hospital, and it's just been crazy. We are. I think I think it was the mayor that actually said that we could potentially turn into a COVID hospital.
that's becoming more and more of a reality. I wouldn't say 100% COVID, obviously, because we have to serve the needs of the community, but we're actually having to restrict that quite a bit. I'll give you an example. They called me this morning to admit a patient for complications of diabetes, and that usually requires a patient to go up to an ICU setting. They also called me on a patient who had a stomach infection, nothing too serious, something we see quite often, and just a matter of putting the patient in the hospital for a couple of days with the antibiotics and whatnot, and then we sent him home. I couldn't admit neither of those two patients at all because we don't have the resources for that. That diabetic patient that needs to be up in ICU, I don't have an ICU bed for that patient. As a matter of fact, we don't have the ability to take care of any ICU patients in the hospital at all. That patient, unfortunately, with a diabetic complication, had to be sent out to San Antonio, something that we would ordinarily take care of here. That other patient with the infection that we call diverticulitis, simple plain Jane type of infection, cannot take care of that patient because we didn't have the resources in the medical surge area, we call the med surge area. Don't have the resources for that. So those two patients who would ordinarily be kept here had to be shipped out to San Antonio, and that's happening more and more. So, you know, it impacts the community that are even non-COVID, because these patients were not COVID, they were non-COVID, but we could not accommodate them. Most of our beds in the hospital, most of the patients in the hospital are COVID. In our med-surg area, I believe there's about less than 10 patients that are non-COVID. So there's an impact in the medical community, and in that we have so much COVID that we can't take care of our non-COVID patients. That's a sad reality of what's going on. But I was listening to Mr. Sheedy with his numbers, and yeah, I mean, we're trying to get things more organized. We are getting more organized, and you can see that our recoveries are phenomenal because they are recovered. But we knew they were recovered, but we had to get more staff to reach out to all our positives to make sure that they are recovered. They are, and that's why our numbers are phenomenal in terms of recoveries. Unfortunately, we have the sad reality of this is that we're having a lot of deaths. As of yesterday, I believe there's 41. I know there's probably more. As a matter of fact, I just pronounced a poor lady. She's 80 years old just a few minutes ago. I had to pronounce her. And so, and I'm getting phone calls from the nursing home. It's happening here in the hospital. It's just that's the sad endpoint of this whole crisis, this pandemic, is the deaths. So that's where we're at right now. I know we have help. We're getting more help. We're not short of swabs. We're not short, of our PPE equipment. We're just hoping people are mindful and have, again, like I said, a personal responsibility to themselves, to the family, to the community, to do the things we know that does help to dampen that curve. We're not seeing it as of right now. But I want to believe, I certainly want to hope that we can do something here in the next few weeks. Or less than that, I'm hoping. But, I know people don't like hearing about, social distancing, hand washing and whatnot, wearing the mask. People kind of become numb to that. Like I always say, COVID never gets tired of infecting people. COVID doesn't care who they infect and who they kill, which is what's going on right now. That's the long and short of what's going on is, and the people say, well, there's 1,000 plus positive, but yeah, and look at the numbers of recoveries. Yeah. Well, on the back end, it's causing a lot of strife, a lot of stress, for those who are dying, fighting for their lives here in Del Rio, and elsewhere. we've been lucky to transfer some patients out. I'm in the process of, as we speak, of transferring some more patients that are COVID-19 that are not doing well and getting them to San Antonio. But the sad reality is that there's some that are not going to make it. And, I've been here for years. Of course, I'm from Del Rio. I've been here in the hospital for quite a while. We've never ever had the need to have an ethics committee meeting. We've had the ethics committee, and I'm the chairman of that. Never ever have we had to need to put that into place, to implement that, and we've had to do that because of the realities of some people are just not going to make it. We know that, and if I have to reach out to families and tell them this is where we're at, we're keeping your loved one alive both chemically and mechanically, and even on top of that, they're just not turning the corner. And we've had to have end-of-life discussions with not so much the patient, of course, but with the families. And those are discussions that I don't look forward to. But that's the sad reality of where we're at. And unfortunately, we're going to have more discussions because they keep on coming in. We're fortunate to have some sent out, but most of them aren't. Some of them are dying at home. Some of them are dying in the hospital. Some of them are dying in the nursing home. And it's just amazing. It's like this is surreal. It's like we're living in a movie here in Del Rio. These big city problems that we witnessed, happening in New York and Seattle, New Orleans, Miami, they're right here in our own backyard. And I was like, and I'm so thankful that we have these people coming in from all parts of the country. We have a Navy doctor right now. He's an intensivist and a pulmonologist working in our own backyard here in Val Verde. He's from Bethesda. And I'm so thankful for him being here and other people from around the country. And I'm so thankful, but I'm also just stunned that here in Del Rio, we have all these people who are coming to our aid because our numbers are through the roof. I mean, that's not the way I would like to have a notoriety for Del Rio. We are so bad with our numbers, and we have so many sick people in this town that the state and the government has taken notice and have deployed people to help us out. It's just unreal. I don't want to be the bearer of bad news, but I'm not giving you bad news. I'm giving you the reality of our circumstances here in Del Rio. And I know we're working behind the scenes. Let me tell you, it's almost day and night. I'm not talking about the hospital, of course. That goes without saying. But I do applaud the people that work in the hospital, the nurses, the doctors, myself, the techs. People come into this hospital knowing there's COVID everywhere. And we come in, we put our suit of armor and, put our health, in jeopardy. Of course, that's what we signed up for. And so we do it day in, day out. But I also applaud the governments, the local governments, both city and county, for stepping up as well. I can speak on behalf of our task force through the county with Roland, and we also have some new people who have joined us. Dr. Palau, she's a physician here in Del Rio who has joined our task force. We have Dr. Muskis, who's retired, who is coming in to help as well. We have some people that are doing the tracing, investigating, Amanda Lauco, Martin Soto. We have some other people coming in. We have a couple of nurses. So we're beefing up our task force, and even so, we may need even more because our numbers are just so incredibly high. So we're beefing up our task force. I know John Sheedy and his people are doing their job and keeping up with the numbers. I know we need to get it more organized, but you know, we're stepping up to the plate, and I applaud everybody who's doing that. I think the medical community in general, I know we're kind of focusing on Val Verde, but there's other places in town that are stepping up as well. STAT is doing awesome. I have to put a little shameless plug for my clinic, who's doing a phenomenal job in taking care of COVID-related patients. Everyone's putting their health on the line. We're right there in the forefront. I mean, we're meeting COVID head on. I think we're doing a phenomenal job. I wish we could come to a point where we can throw away our PPE and our swabs because it's no longer in our community. We're not there. That's the plan. That's the goal. That's the hope, is to get there. We can just throw away all our equipment, our swabs, and have these phenomenal physicians who came. We had one doctor who came from New York. And so what a blessing to have a physician from New York come to Del Rio and help us out. A physician from Bethesda, Maryland, who's here to help us out. I wish we could get to a point where we could say, you know what, docs, thank you for your services, but we no longer need your help here in Del Rio. And we're not close to being at that point. That's where we're at right now.
Thank you, Dr. Gutierrez, for that. You know, the update, it is feeling a bit surreal to recognize the fact that we're one of the nation's hotspots. I was speaking to a friend of mine who lives in Hawaii, and when I told him the numbers, he had to ask me several times, what's the population size for your city? And the numbers for our statistical data is just astronomically high relative to our population. So it's important to hear the update directly from the city manager, emergency management coordinator, and of course the local health authority yourself, so that council can properly assess the current scenario and situation of what's unfolding and how rapidly it unfolded in our community, so that we can ensure that we're properly making the decisions that we need to make to keep our community as best protected as we possibly can, and to educate the public on the severity of the nursing, doctors, emergency response teams, and everybody. So I want to thank you again for your dedication to the medical group and for your dedication to our community, Dr. Gutierrez. Thank you, and proceed on to the council meeting. If you'd like, you can stand by if we have any questions for you. I'll be sure to have council ask. And we all understand that you may need to go to take a call, so please don't hesitate to take that call for medical response. But I'll proceed on to the meeting. Council, do we have any questions or concerns regarding the updates from the city manager, local health authority, or emergency management coordinator at this time?
Mr. Mayor, this is Councilman Russo. I have a question.
Go ahead.
I just wanted to confirm. So, how many, as a just rough percentage of the tests that we're doing in Del Rio right now are for asymptomatic people?
That's a good question. I don't know if I have that number.
I don't want to.
I could tell you the numbers are low.
But it is fairly low. That's correct.
Fairly low. Yes. Okay. I mean, I don't. We're not encouraging anyone.
Yeah.
To say, hey, are you asymptomatic? Come on in. It's like I talked to a large number of families, as does our task force, and we don't encourage people to come in and get tested when they're asymptomatic. You know, we tell them, you know, to be mindful of the symptoms, and of course, you know, check their temperatures. If they have mild symptoms, they just might want to stay home and weather the storm at home.
All right. Well,
so we're encouraging
I just wanted
people
to, make the point that, people talk about how we're getting more positives because we're doing more testing, which is true. However, we're getting positives from symptomatic people, which means that people are being exposed, which is what we've been talking about, for months now, about how we aren't trying to defeat the disease by doing the social distancing and the mask wearing and washing your hands. That is not going to defeat the disease. The pharmaceuticals are going to take care of that when they get around to it. We are trying to slow things down so that, as you said, we don't have a COVID-19 only hospital, as we are pretty close to. And so if, people are getting positive because they're tested, but if we're primarily testing, symptomatic people, we have a reason to test them. This isn't prophylactic where people, I had no idea that I was even exposed. This is for people that are actually, being told to go get tested by someone because they have the symptoms. And we need to stress that. We can't stress that enough. It's honestly getting a little bit old telling people, hey, you have flu-like symptoms, don't go around other people, so we need to stress that. And then, Doctor, I've one other question, don't want to have a real long discussion, but there is confusion about the role and relationship between you and the base public health, because I know that people are being tested out on the base. They're not being contacted by you or the county sheriff with the stay-at-home order, and they are being cleared by the base public health. And if I remember correctly, at the press conference, almost 2 weeks ago now, I thought you said that the base public health people aren't allowed to clear people out of quarantine after they've been tested. Can you discuss that?
Well, I mean, that's how it's supposed to be. I do work closely with the public health people at the base, and they do a phenomenal job. They have cleared some people. I've seen that happen. I've had some of those patients call me and tell me that their employer wants a release letter from the county, from the local health authority, which is me. So I do get some of those phone calls. I'm assuming that there are some people who get their clearance from the base and there's no qualms about it. So, I have some people that call me and say, well, the base people that say, well, I need a letter to go back to work, or I need a release letter, when they already got one from the public health people at the base. So I know there's quite a number of them that I don't hear from because they were tracked and released from the public health personnel. But I also receive phone calls from civilians who say, I need a letter from you. So I know
the people that are calling you, were they tested out at the base, or were they tested in town?
Some were tested in town. Some were tested on base. I know it's an imperfect situation that we have right now. But because I know that there's some people that are being cleared, and I don't have any qualms about that from the public health people, because I know they're following the guidelines. And I've spoken to them, and so if they release someone, I don't have any qualms whatsoever. I do get some phone calls on the back end to say, well, doctor, I need a letter from you, which I'm more than happy to do. I think we have to have more lines of communication between here in town and on base. But like I said, they release people. I know they follow the guidelines, and I have no qualms whatsoever. So,
okay, thanks. It's just confusing when, if someone gets tested in town, even though they work on the base, as compared to they get tested on the base because they're retired and that's where their PCM is. And now, because we had the article in the paper a couple weeks ago where the sheriff was talking about how they're notifying people, and none of the people that I've talked to who got tested out on the base have ever been contacted by anyone from the county. And
I'm not sure if we're getting all the positives from the base, to be honest with you. And I want to say that we have some of them are positive, but I can't say that we have all of them. I'm sure there are some people that were tested, treated, and released from the base that we probably are not completely aware of. That's what I'm saying. It's an imperfect situation that we have, and there's room for improvement. I'm certain no one's dropping the ball in terms of the management and release of our positive patients.
I don't think anyone's dropping the ball either. I just, we just need to try to be clear and consistent on the message. And if the base as a federal installation is doing its own thing, we just need to know that and make sure that people are aware that if they're, cleared by the base, that is equivalent to being cleared by you. So then there's no confusion. So that's all I'm saying.
Like I said, I hear what you're saying. Like I said, I have no qualms in how they release their patients, or I've had discussions with them. And I may never hear back from that patient. At the same time, I get some phone calls saying, "Doctor, I need that letter from you," and which I'm more than happy to help out with. Having said that, yes, I think there's room for improvement to make sure that everybody's on the same page. But both entities are following the guidelines.
Thank you much. That's all I have.
Okay.
Thank you, Councilman Giroux. Councilman Salgado, do you have any questions or concerns for the three updates so far?
Yes, I have a question for Mr. Wanofsky. My question has to do with the interlocal agreement. This past week, we got 2 interlocal agreements and a letter that you had, a copy of a letter you had sent to the county judge and some other information, but I had several calls yesterday, and it was based on, I guess, a Facebook thing that the county judge had a Facebook report, and the people that are being hired don't jive with what we have on the interlocal agreement that was sent to us. So what exactly are we looking at, Mr. Wanofsky, and whatever the agreement was, why is it that we're not getting it? So that we have the real information, so that when people ask us, we can assure them that this is what it is.
Those were the 2 latest that were sent to the county, and yesterday he sent some figures that we could finalize or revise the interlocal agreement. The only change that's there, it changed the 1 physician's assistant to 2 registered nurses, but everything else on the last one that we sent has been okayed by the county, as far as I'm concerned.
Okay, when will we be getting a copy of that interlocal agreement? And also, real quickly here, these indicated that the last one indicated that there would be, I believe, 8 tracers. One of them, I believe, said something like 4. Another one, I think, said 8 tracers. And this one person that called me yesterday said that there were 8 tracers. So what is the actual number on that?
The first one was 4, and we moved it up to 8. So that's the most recent version that we sent to the county, is 8. And you'll get it as soon as it's finalized between the county and us, and we'll have a resolution on the agenda for you guys to formally approve it.
Mr. Wanofsky, I don't know what happened. I didn't hear hardly any of what you said except for your last sentence, because my mic, for some reason, went off.
I said the original agreement did have 4 contract tracers. We increased it up to 8, and we will have that to you to be finalized at upcoming council meeting as soon as the county and city agree.
Okay, now it's my understanding also that the school is being contacted to also participate in this interlocal agreement and help fund some of these items, or what? What's the story on that?
Yes, the school has a separate interlocal agreement with the county. That's between the county and the school district.
Okay, well, I wish that we were kept a little more up to date on you know, like this last one here. So if we could have a copy of that so that we know exactly how to respond to people when they call us.
Yeah, I don't have a copy of the signed agreement between the county and the school district, but as soon as I get one, I'll share it.
No, it does, as far as the school district, if the city is not involved with it, I'm more concerned with what we're involved in, what interlocal agreements we have with other entities.
Yeah, it's only the one with the county.
Okay. Thank you.
You're welcome.
Thank you, Councilman Salgado. Councilman Garza, any questions, concerns at this time?
No, sir. Thank you.
Thank you, sir. Councilman Ojeda?
At this time, well, yeah, there's an influx in other cities with their numbers. Some tend to go down, like let's say in Dallas, and daily counts. For example, last week, one day it was down to 400 positive cases, and then the next 2 days went up to 800 and then 1,000. And I don't know what the causes or the trend, what causes that trend. Sometimes I think if people see that numbers are going down, they feel more relaxed and start to go out and stuff. But I'm just curious about any trends, or would just like to express my concern for any trends that might occur within the next week. If numbers go down, I would just be cautious about feeling comfortable and going out.
We may have a day or two where maybe the numbers are down, but I can tell you that it's typically the calm before the storm, because I work closely with the infection control nurse here in Val Verde, and we're always in constant communication because she's the one that gives me the positives for Val Verde, which includes the ER and the walk-in clinic, which is like, I would say, the mother lode of the positives in the community, because we get some positive from my clinic. They're usually no more than 9 to 10 at a time. We get some from STAT, and they're, small numbers. UMC gives us a fair number of positive, but the mother load is through Val Verde. And when I go a day or two with like no numbers, I'll tell the nurse, I said, "Are you serious? This is all we have?" And in the back of my mind, I says, "Well, this is the calm before the storm." And sure enough, a day or two where our numbers are low, the following day it's like, my God, we just got hit hard again. So I don't see any meaningful trends that people would feel comfortable with. I hope we get to a point where we can see the numbers trending downwards, a meaningful, steady trend on the downward downward slope of that curve. I would hope we get to that point, but we're not there. We may have a day or two where it seems like it's a lull, but consequently, we see that number just kind of take another spike in the wrong direction.
Okay. No, thank you. I just like to. It's just something important to look at, and I'm sure you look at it. Just trends and with school coming up and all this. If you have any, if you think any trends are occurring, of course, let us know. That's all. Thank you.
Yeah, like I said, the total. I mean, we need to look at the total positives, but on the back end, and the more critical part is, you see our deaths, trending up, and they're occurring like clockwork, unfortunately. I've seen most of the COVID patients in the hospital. We are so busy. This is another sad statement. On top of the physician who's here helping out from Bethesda, we need another 2 physicians, myself and another doctor who's here, to round on the COVID positive patients. So, you know, we put our suit of armor, which is our buddy suits and the full PPE and et cetera. We go out there and run all these patients. And unfortunately, you know, you talk about trends. Well, the trend is every single COVID patient that we have are in their 60s with other comorbid conditions. They're diabetics, they have hypertension, they have asthma, they have this and that. But the bottom line, the common denominator with these people is their age. You know, which is a very unfortunate occurrence, because no fault of their own, they're dying from COVID-19. I know people have some qualms about, well, did they really die from COVID-19 or did they die from this and that? You know, like I said, you know, on all my death certificates, on my discharge summaries, the cause of death is pneumonia due to COVID-19. Now, did they die? Did they have other circumstances? Yeah. The kidneys may have gone to kidney failure as a result of pneumonia from COVID-19. They may have suffered a mild heart attack because of pneumonia from COVID-19. Yeah, those things do happen. But the reason they're there and the reason they're dying is because the lungs take a huge hit from this virus. And then from that point on, it's all downhill. Now, yes, there's things that we can remedy and cut off and help change the tide for these patients. But unfortunately, the sad reality is they don't make it, and that's why you see the large number of deaths in this community.
Right, I understand. Sometimes I think about, I mean, like HIV, it's a virus and it attacks your immune system, and you don't die from HIV/AIDS, you die from the illnesses you get or overwhelm your body. So I understand that.
Mm-hmm.
Thank you, Doctor. Thank you so much.
Thank you, Councilman Ojeda. Councilman Carranza, any questions or concerns regarding the current updates?
Yes, I do have a couple of questions. This one's for Mr. Winowski. As far as the PPE and food distribution, who are we using from the city to help out with that endeavor? Is that the fire department?
If you're referring to helping out the county and to those that are positive, yes, we've let them know that our fire department is ready to do that as long as they provide us the direction.
Okay,
yeah.
So, and I think there might be a little bit of a disconnect there. Can we provide them with a list of persons to contact and make sure that whatever team it is that you have together, that they know the protocol and what to do when they do make a call? I think if that would probably help out. And I just think, I mean, most of the things I'm going to talk about here these next few minutes will be getting the city more engaged with assisting the county. And of course, we all know that everybody's overwhelmed, and I think everything the city can do to help that. And Mr. Winowski, I know in speaking with the judge, you all have been in contact most every day. But I think just if we can get them that list of people that you do have available and their direct contacts, or however you're going to handle that, so he can have that list and he knows where to refer to. The second question I have is on the call center. How many people are manning that call center, and what are the hours?
There are 2 to 3, and John, can you remind us all the hours?
Yes, they're currently we're running the center from 8 to 5 on the weekdays, and I mean it's available. We have it's manned on the weekends. It's even available after hours on the weekdays. People check in and they leave. If people will leave messages, we do call people back.
Okay, and I've had a few calls about that. You know, and I think there's probably more people calling in because there's more people testing positive or are going to get tested. And I know when we first started this, we had longer hours and we had cut back because we went through the lull where we didn't have that many cases. But Mr. Warnowski, we can look at least during the weekday, maybe extending those hours that the city is available to answer questions. I'd like to see that go, if possible, maybe to 9 o'clock or so, at least during the weekdays, and then the calls on the weekend to make sure that they're being returned on a timely basis. And also, are we able to answer most of those questions?
As far as most of the questions that come into the call center, Councilman?
Yes, sir.
Yes, to the best of our ability. I mean, the ladies over here are able to handle most of the questions. I get, sometimes 2 or 3 a day that come over here where they're not certain. And sometimes we have to reach out to other folks. We pass those over to the county, if we need help over there. But for the most part, we try to, get them to where they need to go to get the question answered. If they're the hospital, I mean, I frequently call the hospital myself. We talk to the hospital. I sent emails out yesterday, as a matter of fact, on some concerns that had come up. And we do communicate with the hospital and everyone else.
Okay, good. And if you would, maybe also you could visit with Judge Owens and make sure you all are both on the same page. I think maybe some of the questions are repetitive. A lot of people have the same concerns. And just to make sure, let's take a look at that if we can. I'd appreciate that. Now, the third thing I wanted to talk about is the tracers. So I know that we're going to be talking about having a total of 8 tracers. But right now, Mr. Warnowski, do you know how many are actually hired?
2 to 4. I don't know the exact number. John or Roland may know best.
Yeah, and I understand it is, I think, it may be as low as 2, but I think they're also having trouble filling even some of the positions that have already been approved. And then, of course, we know this last month, everybody has just been totally overwhelmed, trying to follow up with all the new cases. I know that the county EMC is having to go through quite a bit of paperwork with new cases. If you get 40 or 50 or 60 cases a day, and trying to go through all of that and get that information processed accurately so we can get the information out to the community, it's very difficult to do with the amount of people they have available right now. That process will get better as we hire the more tracers, but in the meantime, I think everybody's struggling and everybody's looking for information. So on that grounds, I'd like to see if the city could come up with a task force, maybe of 4 or 5 persons, to help with that endeavor, to see if we can get them caught up a little bit until we can get the COVID tracers hired. And I think that we need to, I just think that'll be a great help, and that'll benefit the whole city of Del Real and all of Alberta County getting the information. It's just too much information for them to process with the few people they have. So maybe we can put a task force together. Maybe they could go over and help them out, let's say, for a half day. I know that the school district has provided a building now for them to work out of. So I'd like to see if you could come up with something for that temporarily until we can get the other COVID tracers hired. It's just, it's an emergency situation here in Del Rio, as the doctor's been referring to. There's just too many sick people, and we don't have enough help. So, and I think we need to get the team that if you can work this out, needs to be somebody who has very good organizational skills, who can handle large amounts of information in a short time frame. And I think that would go a long ways for helping with a pandemic.
If I could, Councilman, I would like to add that we have the Emergency Operations Center here. This offer has been, we've discussed it numerous times. We've offered to bring staff in, whatever we can do. If they'll, we've offered to do contact tracing, and they weren't, possibly to that level. We've offered to assist in any way we can. We've identified staff that are ready to come over, and unfortunately, we just haven't been given that clear direction of exactly how we fit into that, how they anticipate us to fit in. But certainly, we've wanted to provide that. We've got the Emergency Operations Center here. It's a huge facility. Eagle Pass uses their Emergency Operations Center for just this purpose, and we're absolutely here to assist in any way we can. If the county will let me know and Mr. Winowski know, we will move everything we can move to get everything in place.
Sure.
I'll reach out to the judge directly in regards to this. And in addition, we did say we are sharing the posts or social media posts about hiring those tracers to help spread the word about that position opening. So that's another small way we can help. But I'll reach out to the judge directly on this.
Sure. And I think one of the concerns about using the EOC was maybe that we have another emergency pop up. So that was one of their concerns. So I know they acquired, I'm not sure, it's a building over by Lonnie Green that they're going to let them use kind of as a COVID tracing center. So I think it'll work best. They know the procedures that need to happen. And I think if we can work with them over there, I think that would really get us engaged in what's most important right now for the city of Del Rio. And then one last comment I did want to make. I think Mr. Winowski, there was a question about who's the contact for the city of Del Rio, and I think that the council appointed Mr. Winowski to be the go-to person, and I just want to make that clear that nothing has changed. Mr. Winowski is available to anybody who has questions on COVID and he's definitely handling all of the council's concerns. I know he's doing that, and I just want to thank you for taking on that role. That's all I have.
Thank you, Councilman Carranza. Councilman Erita Caron, any questions or comments regarding the current updates?
No, sir, I have none. I just think it's very important that we continue working with the county hand in hand. It's not a, county city concern. It's a community concern. Again, I know Mr. Winowski's been available and he'll continue to be available as the contact person. And just to reiterate what Mr. Carranza said, that, whatever it is that the county needs, that we're here to provide that support, and that we continue to move forward as we, as we attack or, proceed to take on this giant. And I just want to thank the task force, everybody involved, the county, the city. I know that numerous hours are put in. Y'all's work does not go unnoticed. So from the very top, from our local health authority, Dr. Jaime Gutierrez, to emergency management coordinator for the county, Roland Garza, and city emergency management coordinator, John Sheedy, and everybody else who takes such an important role in making sure that information is disseminated to the community, and that, all the work is done before those numbers are released. That's all I have, sir.
Thank you, Councilman Elizalde Calderon. And next, we're going to have an update from the enforcement from Chief Knoll. Chief Knoll, are you available?
Yes, good evening, Mayor, Mr. Winowski, and staff. I do have some numbers to give y'all. And before I start, Mayor, is there anything particular that you would like me to address before I get to my notes?
Nope, just overall the update on the current park enforcement, what you've been seeing out there, and just the concerns that you may have before we go into the next conversation, which is going to be the declaration discussion. So,
absolutely, sir. Our total contacts roughly during the time that we've been down at the creek since the inception of the declaration and the ordinances has been roughly about 650 people. I do want to clarify that number. Last council meeting, I made a comment that our contacts had been roughly about 500. And what I meant by that is not that we went and broke up a party or a concert of 500 people, but in total, the amount of individuals that we've had to come in contact with or, ask them to leave or inform them that the park is shut down or we were reported a suspicious person or something being out there has been roughly up to this point about 650 people in total. Of those, we've had a total of about 10 citations that have been issued since the beginning. I spoke with Judge Bain this morning, and roughly since about the middle of last month up until present day, we are at 7 citations that were issued during that time frame, and then there was a couple prior that I had mentioned, totaling about 10. In addition to those, our arrests have still been the same, which were 2 for folks driving motor vehicles in the park and then trying to evade from the police to get away. The other was a public lewdness concern where we had an individual that was exposing himself, to folks that were exercising. That was an arrest. I did speak to my staff this morning. We've assigned a lieutenant to the overall operations of the Creek Patrol and special functions that we're having to perform because of COVID. And they have reported a significant decrease in the last 2 weeks of the amount of people that they're having to contact. I've been doing some drive-bys out there myself and at the retail locations where, we figured are most likely to be problematic. And I will tell you, I have noticed the same in about the last 7 to 10 days. There's a very big decrease in the amount of people that are showing up, to how many cars you see at one time at Walmart, how many cars you see at once at HEB, and the creek. Every drive I've made down there or got out to look around has been 0 at the time I've gone out there. And it's been at random several times. And I did confirm that with speaking to the bike officers. Just to give you an example, typically on a regular day, the officers were averaging about 10 to 12 contacts after the parks were completely shut down. This Saturday, our bike crew that was working only reported contact with 2 people, period. And that was from Moore Park all the way down to the Rotary Park. So folks are complying, to be quite honest with you, and speaking to people or getting any information from the officers when they talk to these folks, or other people, that they've come across. People are scared. People are very scared of what's going on. I think this thing has really touched our community. Somebody they know, somebody's relative, a coworker, their child's teacher, or somebody that they knew. So it's really hit home, and I think people are wanting to abide by the rules. You're always going to have that select few that don't. Yesterday we had a couple of instances where the officers were right in the middle of a shooting that we had. We ended up with 2 calls of COVID-related non-compliant folks. One was a juvenile that ran away from home, knowing she had COVID and her mother was concerned. The other was an individual who was, suffering from some mental distress and took off on the officers while they were trying to get him some help, and they had to get into a foot chase. So those are things that we are dealing with, and we're starting to see a lot more responses to homes as opposed to people, just getting sick or passing at the hospital. Our officers obviously do have to get involved in any type of a death that occurs, away from a medical facility. So unfortunately, those calls have been on the rise for us lately because of, the amount of folks, that Dr. Gutierrez mentioned. One thing I do want to put out there, I really appreciate our public. We have had a lot of support. We've had people calling in. Like Mr. Sheedy had mentioned earlier, they take a lot of calls up there at the call center. And I want to say that the volume has decreased because I have one of my employees who's signed up there as detailed to them to help. And she told me the calls have diminished, but the seriousness of the calls is what has increased. And that's simply because of all the exposures. There are some people that are just scared to death. They have very complex questions that involve their employment. And it's real hard for us because, we can't give legal advice, but we try to point them in the right direction and give them the resources that they need. But I am very proud of our community. I know this was very hard at the beginning and a lot of rock throwing about people being upset. That places were closing. But I do want to thank y'all for making that final decision because it's not only just made our job easier as police, but we are doing our part to protect the public, and it is for their good. One thing that I have told our folks, we are not in the scaring people business. We're not going to go out there and scare people. We're not doing this for fun. It is just merely a true life situation, life and death that's going on out there. And one of the problems we had to tackle was the younger community. They're not sick. They heard it was mostly affecting older, generation folks, and they, for lack of better words, 18, 20 years old and bulletproof. And our officers had to have some talks with those folks that were gathering in parking lots, and they have since complied. So, I really thank the younger community. And we're seeing a lot more things than we ever did. And if I could just add my piece in there, it'd probably be a little bit of a tag on to what Dr. Gutierrez mentioned earlier, where we personally as police are seeing, I think what may be contributing to the spread, some of the calls to residences that we're getting from concerned family member because they've lost contact with that person because they're under quarantine. The family can't go check on them regularly, so they're calling us. On a couple of instances, we've gotten there and we found these people in very bad shape or passed out on the floor in need of immediate medical attention. We had a call the other night where we couldn't find the lady due to her doctor having an old address. When we finally got the new one, the officers went straight to it, found the lady passed out and having trouble breathing and dehydrated. So when we did a little more looking into it, we found out that these folks who are sick, they get scared, they're lonely, and they're going and visiting family and stuff because they're afraid of what could happen. But in turn, what's happened is the spread has now happened somewhere else. The case yesterday with a runaway juvenile, knowing that she was, positive, ran off to go hang out with some buddies from what we gathered. And there you go. Those are the things that are hurting us right now. And unfortunately, there's no law, no ordinance, no declaration that is going to physically stop what some people choose to go do. We just have to have those things in place so that when the time comes and we can enforce them, then we will. But for the most part, our public has been very receptive. The folks at the park have understood. The few we've contacted all complied immediately upon my officers making contact with them. So I will close by saying I want to thank my staff. I want to thank the fire department, EMS. Sheriff Martinez and I have probably talked to each other more in the last 2 weeks than we ever have in our whole careers, working around the same type of law enforcement career together. But that's just what it takes. We're all busy. The folks at the city, the mayor keeping in contact with me, everyone has helped in some way. And I want to say that we're seeing a lot more compliance is, my report to y'all.
Thank you, Chief Knoll, for that update. And I'll go ahead and go around with council for any questions regarding the law enforcement side of things. Councilman Ojeda, any questions or concerns?
Thank you, Chief Knoll, for that update. Thank you so much for all your work. That's all.
Yes, sir.
Councilwoman Salgado?
None, just thank you to everybody that's out there doing their best.
Councilman Garza?
No, sir. Just again, thank you as well to echo the comments from the council. Thank you all for the hard work.
Absolutely. Thank you, sir. And I appreciate the information you've been sending us from your full-time employment as well. That's helped streamline things a lot.
Yes, sir.
Councilman DeRose?
No questions.
Councilman Carranza?
No questions.
Okay, and I have no other questions. Councilwoman Elizalde Calderon?
No questions, just a big thank you to Chief Knoll and his staff for all their hard work and effort.
Thank you, ma'am.
Okay, thank you, Chief Knoll. And so that concludes all the information updates for this portion of this item. And now we're going to proceed on to amending the city's emergency declaration ordinances. I'll go ahead and ask council if they have any questions or concerns regarding the current declaration. Councilman DeRose?
Negative.
Councilwoman Salgado?
None.
Councilwoman Elizalde Calderon?
No, sir, I have none.
Councilman Garza?
Yes, sir. I know that Matt had, Mr. Bernowski had gone through some of the figures on the CARES Act funding. Matt, can you run through those numbers again real quick on what we've expended?
Sure. I don't know if you missed the portion, but there's actually two funding sources. We're using the FEMA PA or Public Assistance Grant for medical, public health supplies, and payroll for reassigned or temporary positions. And the group amounts for those are medical currently at 11,000, a little over 11,000. For public health supplies, this include masks, disinfectant, sanitizer, thermometers, plexiglass. We're currently at a little under 134,000. For the payroll for the reassigned and temporary positions, 81,000. Currently, however, we have an additional projected estimate of 258,000, and that includes those positions that are mentioned in the ILA with the local health authority in the county. The CARES Act, so the total of that is 403,000. For the CARES Act funding, which we can use that to be our 25% match for the FEMA, because the FEMA is 75% paid. Currently projecting an estimate of 142,000 for the CARES Act to use to be the match for the FEMA one. Under CARES Act for the payroll for budgeted positions, our current estimate is about 486,000, and this is primarily for EMC, public media, and police park patrol. And our additional projected estimate is roughly the same amount, because we're at about the 50% mark using the December 30th deadline. The two remaining categories for CARES Act, technology and compliance, we currently spent a little over 29,000, and we have an additional projected estimate of 174,000. And the last category is small business program. We've already spent 100,000 on that program, and we estimate spending the additional 100,000 that's used to support our local businesses. So our total projected estimate for the CARES Act funding is a little over 1.5 million at this point.
Okay, thank you.
You're welcome.
That's all I have.
Thank you, Councilman Garza. Councilman Carranza, any questions or concerns regarding the current emergency declaration?
No, I have none.
Okay. Councilman DeRusse?
Negative.
Councilwoman Elizalde Calderon?
No, sir, I have none.
Councilwoman Salgado?
None.
Councilman Ojeda?
No, no, I don't have any right now. Thanks.
Okay, with no questions regarding the current emergency declaration ordinance, I will go ahead and move to extend this declaration. Let me get my calendar out. I would move to make this, to extend this declaration to expire at 11:59 on August 11th, which is our next regular scheduled council meeting. Is there a second?
So moved.
We have a motion and a second. Okay, we'll go ahead and take a vote. All those in favor? I'm in favor. Councilman Salgado, in favor or opposed?
In favor.
Councilman DeRusse?
In favor.
Councilman Garza?
In favor.
Councilman Carranza?
In favor.
Councilwoman Elizalde Calderon?
In favor?
Councilman Ojeda?
In favor.
Okay, the motion does carry. The current declaration as is has now been extended to August 11th, expiring at 11:59. City Secretary Acosta, is everything in order with what just passed?
Yes, sir, it is. Thank you.
Thank you kindly. We'll now proceed on to the next item on the agenda, which is the discussion and possible action to appoint local health authority, the LHA. Is there anybody that can provide us information?
I guess this agenda item would appoint a local health authority for the city.
Okay. I'll open it up to council. Councilman Elizalde Calderon, any questions or concerns?
No concerns. No concerns at all. No questions either.
Okay. Say that again.
I have no questions, sir.
You're breaking up. Okay. Councilman Ojeda, any questions or concerns regarding the local health authority?
No, sir.
Councilwoman Salgado?
My question is, do we have somebody in mind, and if so, who is it, and what kind of time frame are we looking at?
So it's my understanding that we were looking at appointing Dr. Gutierrez to also be the same local health authority for the city. I know Councilman Elizabeth Calderon had reached out to discuss that. Dr. Gutierrez, do you have any comment or concern regarding the local health authority appointment? Should you be appointed? If you're still on the line.
Yes, I'm still here. Well, it's a lot, for anyone to do, but I think in a way it kind of makes sense if it's possible, and only if it's possible. I know the city and the county need to work together, and they are. I think things can be a bit better. Of course, they can be better in any category, in any aspect of COVID-19 in this pandemic, whether it be in the hospital, the community, local governments. But we all have to rise to the need, and including myself. So I'll be happy to do that if that's what it comes down to.
Okay, thank you, Dr. Gutierrez. So, Councilman Salgado, Dr. Gutierrez would be the person to appoint to answer your question at this time.
Okay, I was just curious as to who we had in mind, and I wanted to make sure that Dr. Gutierrez would not be overwhelmed with everything that's going on and having to be answering to two different entities. So that was, if he's comfortable, that he's able to do it, and it's not going to drive him absolutely nuts, which, as it is, it's already pretty overwhelming. But if he's okay with it, I don't have a problem.
Thank you, Councilwoman Salgado. Councilman DeRusse?
I would agree with Councilwoman Salgado. I don't think that we need to appoint a separate person. I think at this point, with the processes that we have in place, as well as the additional people that we're helping to fund, all of the tracers as well as the actual medical people, that would probably work. But I don't see anything in there to address Councilwoman Salgado's concern, which I share, about the chain of command and how who's he going to be reporting to, because I hate to have now multiple people calling him, potentially taking up time and further occupying an already very busy man. So that would be my only concern, but it doesn't matter, because whether or not we formally appoint him as as the city local health authority, he is for the county, and so he already covers that. So I would recommend just not appointing anyone else at this point. That's all I have.
Well, I appreciate your comments. All comments. I'm looking forward just to add, but it's been very hectic. But it seems like that's been my norm for quite some time now. So unfortunately, I've been in beast mode for quite some time. So adding this to my plate is not anything that it seems to me overwhelming, because that's all we've been doing. That's all I've been doing. My career in the last several months has been COVID, and then some other things that come along, but it's been COVID and COVID only for the most part.
Thank you, Councilman DeRusse, and thank you, Dr. Gutierrez, for that feedback. Councilman Ojeda, any questions or concerns regarding the local health authority appointment?
No, I mean to say yes. I just hope, should Dr. Gutierrez need anything from us, any assistance. I mean, I understand that he is already the local health authority through the county, so he still has Del Rio, in his Ms.
As
Padilla.
I understand it, and as I understand it, I won't be receiving phone calls from, not necessarily the council members. I may be working if this becomes a reality. I'll probably be working closely with John Sheedy for the city, of course, Mayor Amasano as well. There might be one more else that I'll be communicating with. So it's not like I will be bombarded with all kinds of calls coming from multiple people, but this may be just a select few.
Okay. All right. Well, we're here to help in any way we can to support. That's all.
Thank you, Councilman Ojeda. Councilman Garza?
No questions. And the only other thing would be is that at a later meeting, when he has an opportunity to visit with Dr. JJ, just discuss a salary, and we can either approve or have that discussion next meeting so we can discuss that.
Thank you, Councilman Garza. Councilman Carranza, any questions or concerns?
And no, I just want to, it makes all the sense in the world that we appoint Dr. Gutierrez to fill this role. And as he mentioned, I think he's going to work most closely with Mr. Sheedy, the mayor, and Mr. Winowski, I would assume. So having said that, I'd like to make a motion that we appoint Dr. J.J. Gutierrez as the local health authority for the city of Del Rio.
And I'll second that motion. We'll go ahead and take a vote since we've already mentioned all our concerns regarding this. And this will be coming back. And I would just like to amend the motion to make sure that this comes back in the form of a resolution after the local authority has negotiated the pay as Councilman Garza has suggested. We can discuss that during executive session, I believe. Is that correct, City Attorney West?
Yes, that's correct, sir.
Okay, thank you. So we'll go ahead and bring that back at the next council meeting. So we have a motion and a second with the amended motion. City Secretary Acosta, would you please repeat the current motion?
Yes, sir. The motion is to appoint Dr. J.J. Gutierrez to be the city's local health authority and to bring this discussion back in the form of a resolution to include discussion of salary during executive session.
Okay, great. Councilman Carranza, does that motion carry with you?
Yes, I'll change my motion to be just what the city secretary read. Thank you.
And I'll second that motion. So we're going to take a vote. All those in favor, Councilman Carranza?
In favor.
Councilwoman Salgado?
In favor?
Councilman DeRusse?
In favor.
Councilwoman Elizalde de Calderon?
In favor?
Councilman Garza?
In favor?
Councilman Ojeda?
Favor.
And I vote in favor, so the motion does carry. Thank you, Dr. Gutierrez. We'll be in touch to get the rest of the details out for you and to make sure that you're available for the executive session portion of that future meeting. And Council,
Okay,
I just
great. Thank you.
to go ahead and just wrap up the city public announcements, 3A and 3B. I just wanted to thank the entire staff of the city of Del Rio that has been instrumental in ensuring that the pandemic doesn't completely succumb our community. We have been communicating with all the elected officials up and down the chain, including Senator Flores, Representative Congressman Will Hurd. We've been in keeping up with all of Governor Abbott's declarations and everything. And as far as ensuring, I just want to give the biggest compliments to Mr. John Sheedy with trying to continuously be informed as far as the data collection goes. Last week, when Judge Owens, myself, and Councilman Elizalde de Calderon met with Judge Owens at the time, we were very thrilled to be getting the data so that we can properly do what we did earlier today with the update as far as the graphical material is concerned, and it looks favorable. So that way the community has a better cross section of what's going on. And again, we just want to congratulate or compliment and thank all of the firefighters that are standing by to deliver the products that are needed, the pharmaceuticals and the food, and also to all of our workers that are currently displaced. Mr. Matt Winowski has identified staff to ensure that they're available to deliver products and food services. Once we get those names and numbers and information, And again, I stand firmly behind our dedication of the city to the success of the local health authority, Dr. Gutierrez. And with tonight's vote to appoint him as local health authority, that'll only excel and enhance and continue to work in tandem with our county counterparts. I want to compliment the San Felipe School District, San Felipe Del Rio Consolidated Independent School District for stepping up as well and providing resources that are more in tune with our local health authority needs. So again, Council, I want to thank you again for your continued support regarding our efforts as a city, representing the city everywhere, that every person that I talk to, and ensuring that we all are cohesive and collective and working to get through this pandemic that has completely taken us to a whole level of urgency. And with all of your dedication, all of your hard work, speaking with constituents and getting that information out, I want to thank you as mayor that all of your support really helps and amplifies our success. And one day we'll look back at this through this difficult time, and these moments like today are going to be instrumental for our success, and hoping that we can continue to mitigate the spread of COVID-19 and keep the death rate low. So thank you all, Council. With that being said, I'm going to go ahead and take a 10-minute break. The current time is 8:16. We'll reconvene at 8:26. Thank you. comments. It's my understanding that no citizens' comments signed on, so we'll now proceed on to community services. Item 6.1A, Resolution 2020-065, a resolution confirming the appointment of Heather Fletcher to fill a vacancy on the Parks and Recreation Advisory Board. Is there a motion?
So moved.
And I'll second that motion. Council, any questions or concerns regarding the vacancy? Councilwoman Elizalde Calderon, any questions or concerns?
Who is she replacing?
She is replacing Natalie Granatelli, whose husband was at the base and they moved to South Carolina.
Okay, thank you.
Councilwoman Salgado, any questions or concerns?
None.
Councilwoman Carranza? Councilman Ojeda?
No, sir.
Councilwoman Garza?
No question.
Okay, and I have no further questions. We'll go and take a vote. I'm in favor. Councilman Ojeda, in favor or opposed?
In favor.
Councilman DeRusse?
In favor.
Councilwoman Elizalde Calderon?
In favor?
Councilman Garza?
In favor?
Councilwoman Salgado?
In favor.
And for the record, Councilman Carranza was still not online just yet. So we'll proceed on to the next item in the agenda. The motion did carry. Item 6.2A, Ordinance 2020-093, Ordinance awarding the purchase of an alignment rack for the City of Del Rio Transportation Program to TRC Equipment LLC. Is there a motion?
So moved.
Is there a second?
Mayor, may I make a clarification?
Yes, ma'am.
The name of the company is TRS Equipment. The ordinance will be corrected as well. The
Okay,
name
so
of
noted with the corrected.
TRS Equipment. Thank you.
Thank you. So there's a motion. Is there a second?
I'll second.
We have a motion and a second. Any questions or concerns? Councilwoman Salgado?
Yes, I have one, but let me real quickly just read here. Okay, my question is, regarding the cost, is there an estimate of the savings for this?
Where we'll see, Elsa Reyes, Transit Director for the City of Del Rio, where we will see our savings is obviously the efficiency of the tires being rotated will allow for fuel efficiency. I think we estimated in the initial proposal when we brought it to you, maybe about $20,000 a year. Over time, obviously, right now, we don't have the ability to take our vehicles anywhere because there's no one locally in town that has the bays that would be able to lift the buses, the larger buses, and we still have 7 big cutaway buses. So this is going to help us in the long run. When the opportunity presented itself for the grant application and for us to fund 50% of it, not realizing how really expensive this equipment is, but not only with tire efficiency, of course, with safety and with the wear and tear on the tires, hopefully the expense of the tires will also decrease that we experience on a yearly basis, annual basis.
Okay, and you have the personnel there to be able to do the work, right?
Yes, and part of this contract does include the training for them to come down and train them accordingly. I was hoping my mechanic would be able to be online today to answer any particular questions, but unfortunately, he's out waiting test results. So yes, but they will provide the necessary training, and they come in from San Antonio. So that is good that they're only 2.5 hours away from us whenever we need them.
Okay, thank you.
Thank you, Councilman Salgado. Councilman Carranza, any questions or concerns regarding Ordinance 2020-093?
No questions.
Councilwoman Elizalde Calderon?
No, sir, I have none.
Councilman Garza?
No question.
Councilman Ojeda?
No questions.
Councilman DeRusse?
No questions.
And I have no questions. We'll go ahead and take a vote. I vote in favor. Councilman DeRusse, in favor or opposed?
In favor.
Councilwoman Elizalde Calderon?
In favor?
Councilman Carranza?
In favor.
Councilwoman Salgado?
In favor.
Councilman Ojeda?
In favor.
Councilman Garza.
In favor?
Okay, the motion does carry. On to item 7.1A, information item update from discussion on connecting to and providing water for development beyond the City of Del Rio city limits.
Yes, Mayor and Council, we'll bring this back at request Councilmember Salgado. I outlined some bullet points on what it would entail on water outside the city limits. I just wanted to go over those briefly. So this will be a decision. The decision to connect and provide water outside the city limits is a decision of the Utilities Commission and the City Council. And they could enact an ordinance requiring voluntary annexation if they met the annexation requirements. Second, the maintenance operations, repairs to water infrastructure, it's paid by utility rates from all the water utility customers or the users. The cost to install the water infrastructure outside the city limits is paid by those requesting it, so it's not usually done by the city, and it's not done through our utility rates. Fourth, as our city's water infrastructure expands and grows through development inside or outside the city limits, all the water utility customers are the ones who pay to continue to maintain and operate and repair the expanded or the bigger system. And that's done by all the utility customers through water utility rates. Currently, the water rate for residences, businesses, and sprinklers outside the city limits is 15% more than inside the city limits. Any voluntary annexation has to be contiguous to the current city limits and meet the annexation requirements listed in Chapter 43 of the Texas Local Government Code. Our utility staff did say that according to TCEQ in an April 2019 calculation, our water treatment plant is at 94% capacity. And this is a number based on the number of connections. It's kind of a general formula. We don't have the specific data to get a better number than that right now. Staff, we will follow the will of the council regarding any approval of water lines outside the city limits. The city just requires that those water lines meet our specifications and that we take into account the maintenance of those new lines when they're accepted at budget time. For those outside the city limits, their options to connect to water systems include our own water system, of course, is one of them, another nearby water provider, or they can do water wells. It was brought to my attention that some of those areas outside the city limits, unfortunately, they don't have a nearby water provider or water wells are not a viable option in some cases. And just as a kind of reminder, currently the City Council has already approved future connections in the following development areas. The Ridgeline subdivision was approved in February of 2018. Work's already started there, but they haven't finished. It has about a little less than 16,000 linear feet of 8-inch line. In addition, city staff, we do have two projects that have been submitted plans, but they haven't been approved yet. That's San Felipe Pastures, about 4,700 linear feet of 8-inch line, and then Rancho Del Rio has about 6,100 linear feet of 8-inch pipe. Lastly, the county may be asking for an additional approval from the Joint Airport Zoning Board for the remainder of the Escondido area. We did include two maps in the packet, kind of showing the CCNs in the Del Rio area, and then the last map shows the water lines that are outside the city limits, and it also has the current CCNs as well. Our staff recommendation for this agenda item is simply that the City Council votes on whether they'd like to make the decisions to for water outside the city limits to, if they can, voluntary annex and meet those requirements to be annexed or not. That's kind of our brief bullet point on helping the council decide what to do with water outside the city limits.
Mayor, if I may comment.
Yes, ma'am, please proceed.
Okay. As I've mentioned to you previously, Mr. Winowski, also my other concern, and it just so happened that shortly after I had mentioned this, then we have water restrictions. Now, our priority as on the council is to make sure that those folks in the city are taken care of. And as we allow more and more water out, our pumps can only pump so much water out. So we need to be conscious of that the day could come when we don't have the ability to provide enough water to our citizens inside the city limits. So that was a fact that, out in the county, and it's not up to me because I have nothing to do with how the county does their business. But it would seem to me that before people go building out in the county or buying property out in the county, one of the first things that one should do is to make sure that there is water on the property and that it is going to be potable water. I don't understand why we don't do it, why it isn't done here in Valverde County, because I know there are a lot of other places. I went through it myself when we lived in the county prior to coming back to Del Rio. But, it's beyond me that people will buy property, but nobody bothers to inform them that if you're planning on building, you should make sure you're going to have potable water and enough water to sustain whatever residents or whatever improvements you plan on doing on the property. But that, like I say, is not my concern. My concern is to make sure that we're going to have enough water here and the ability to provide the necessary water to our citizens. And like I say, it's not that difficult to have voluntary annexation if you want all the city services. And as far as, the maintenance of the lines and all this comes through the amount of money that people through the collection for water. Well, yes, but I also asked, I believe a while back, what was the amount of money that's coming in from water from outside the county and what amount is coming in from the city and what kind of, what is the cost? Because not only is it maintenance, it's also the chlorination of the water and everything in general that's associated with the water. So let's look at all the numbers, because if I recall correctly, here about 4 years ago, the water users in the city were subsidizing those in the county to the tune of about either $120,000 or $150,000. So it would be good to have those numbers. And where I'm not trying to say people should not have water, no, people need to. That's not what I'm saying. I'm just simply saying that our responsibility, first and foremost, is to those people in the city. Those are the people we answer to. Thank you.
Thank you, Councilman Salgado, for that comment. Again, this is a discussion on connecting to providing water, so I don't believe it's an action item at this point in time. And as the bullet points do mention, that would be something that we take on as it comes before the Utility Commission or the council itself. So, Councilman DeRusse, any questions or concerns regarding the update or discussion?
I would like to get input from the Utilities Commission also. I agree that this is something that we need to discuss. It's kind of been bandied about, for the past 2+ years. And then something else that would be related to this, and Mr. Wanowski, we had done approved the rate study. Do we have an idea when we might get some at least preliminary results on that? Because that to me is directly connected to this topic, because it's all about making sure that our water system is healthy monetarily.
I know they're working on it now. I'd have to defer to our finance director on when we might have some numbers from on the rate study. Although I will say, I don't think they're going to be doing an analysis on the expense side outside the city limits. They do take into account the revenue side.
Okay. Well, how would they know what the, potential higher cost should be if they don't look at both of those?
A lot of those companies will say that that's a decision of the city council. Again, we don't really monitor the expenses outside the city limits separate than we do inside. It's just a system, and that's what they apply the rate to.
Okay. Anyway, so one of the reasons why I wanted this discussion is because, if you look at, just do a quick Google search, most cities fall into one of two categories related to their utility system. One category is you have to be in the city limits or else you don't connect. And the other category, regardless of actual cost, generally charges about 1/3 to 50% higher premium if you're outside the same limits, if they allow you to join. And so we just need to have a discussion and figure out what the best way for the city is to look not only at the health of the water system, not only with the money but also the volume, but also what is going to be beneficial and supportive to continue community development. So that's all I have for now.
Thank you, Councilman Giroux. Councilman Ojeda?
No, I don't have any comments.
Councilman Garza?
No comment this time.
Councilman Carranza?
No questions.
Councilwoman Elizalde Calderon?
No, sir, I have no questions.
Okay, and just to comment on Councilman Giroux, we do have the next item is to discuss the appointment of members for the Utilities Commission, so that'll kind of help get that movement going. We'll still have 2 other positions that are currently expired, but at least we have 3 to begin recreating a quorum. I know that there was some quorum related items that are just, for circumstances outside of their control. So we'll talk about that in just a moment. Outside of that, I have no additional comment. It's a great discussion item to bring to Utilities Commission for sure. And then we can always move forward as a council to further discuss this. So with that being said, there was no action item to be taken. We'll proceed on to the next item, which is item 7-2A, Resolution 2020-064, a resolution in accordance with state law and the Del Rio Code of Ordinances, providing for the appointment and confirmation of 2 Class 1 members and 1 at-large member to serve the unexpired terms on the Del Rio Utilities Commission for the City of Del Rio, Texas. Is there a motion?
So moved.
Mayor, this is Roland. We have 2 vacancies. Well, no, actually, I guess everyone's expired.
Right.
You'll still be on the commission, correct?
Correct.
Okay. And then the other is a council appointee?
Correct. So as we had discussed, I think it was 2 weeks ago when I asked you, due to the COVID and everything, if you're still interested in serving, and we had discussed appointing Councilman Salgado at the time.
Mm-hmm.
And so she would be replacing you. And then I reached out to Mr. Sergio Diaz to see if he was still interested. I haven't reached out to the other 2 gentlemen just yet. I wanted to at least get these 3 positions started and then continue to recruit for other positions as we appoint other positions for all the committees as well.
Okay.
Any other questions, Councilman Garza?
No, that is it. So in other words, up for discussion right now would be you're asking for a motion to fill my vacancy, and then for 2 others, or you're not?
So the packet, I believe, reads that we're appointing Mr. Sergio Diaz right now, and then the other 2 remaining vacancies will still be vacant until we find or reach out to them and reach out to other people that might be appointed to those positions.
Okay, thank you.
Yep. Okay, so there was a motion. City Secretary Acosta, could you please go with the motion in a second? I believe I did hear a second.
And we have the motion by Councilwoman Salgado. I don't have a second yet.
I seconded that. Councilman
Did
DeRusse.
you? Okay, thank you.
I think, yeah, because I think Councilman Garza spoke at the same time. Okay, great.
Okay.
So we have a motion and a second. As it pertains to appointing, so I continue to serve as I had been, and then we would appoint Councilman Salgado and then appoint member Sergio Diaz. Council, any questions or concerns regarding those three appointments at this time? Councilman Garza already addressed his. Councilman Elizalde de Calderon?
I do have a question. I'm a little confused. I'm sorry. The reception was in and out. So Councilman Garza's seat is up. Is that? I mean, is his seat up and on that board?
No, what happened is that when I talked to him because of what's happening with COVID, and I know that Councilman Salgado had been interested in serving for this board, I asked him after a council meeting if he'd be interested in being replaced so that he can focus on the emergency management coordination as he serves for the county and also as council.
Okay, I guess so. My question is to Councilman Garza. You are in agreement of stepping down, Councilman Garza?
Yes, ma'am.
Okay, that was my only question. Thank you.
Thank you, Councilwoman Elizalde Calderon. Councilman DeRusse, any questions or concerns?
Negative.
Councilman Carranza?
No questions.
Councilwoman Salgado?
None. My only question is, well, not so much a question, but I'd like to comment that hopefully pretty soon we can get the other two members so that we can have a full committee there, because it's very important in view of everything that's going on.
Yes, ma'am, and we're definitely working on filling the other seats, and it's not just this board, but the other boards as well. So thank you for the comment. Councilman Ojeda, any additional comments or concerns?
No, not at this time.
We'll go ahead and take a vote. Councilman Ojeda, in favor or opposed?
In favor.
Councilman Garza?
In favor.
Councilwoman Elizalde de Calderon?
In favor?
Councilwoman Salgado?
I will abstain since I'm being one of those that's being appointed.
Okay. Councilman Carranza?
In favor.
And Councilman DeRusse?
In favor.
And I'll also abstain since I'm also being appointed in that board. So the motion does carry, correct, City Secretary Costa?
Yes, that's correct. Thank you.
Thank you, ma'am. Thank you, Council. We'll now proceed on to the next item in the agenda, which is item 7.3A, Ordinance 2020-094, an ordinance to award a master agreement contract with the firms Jones Carter for on-call professional services to support the city of Del Rio, Texas. Is there a motion?
So moved.
Is there a second?
I'll second.
We have a motion and a second. Council, any questions or concerns? Councilman Carranza?
No questions at this time.
Councilman Ojeda?
No, not at this time.
Councilman DeRusse?
Negative.
Councilwoman Elizalde de Calderon?
No, sir, I have none.
Councilman Garza?
Who was the firm performing this role prior to?
The contractor, Indian Council, Matt Evans, Utilities Director. The consultant here is Jones and Carter. They're well known in Texas for work with water, wastewater, utilities, as well as public works departments.
Right, but who's currently doing this role right now?
We currently do not have anybody filling this role.
Is this being done in lieu of finding a city engineer?
No, this is separate. This is specific to the utilities department.
Okay, what's the amount?
This isn't a specific contract amount. This is a one-call This will be an on-call contract.
Is there a size up on what that hourly expense would be, or is it done on a project by project basis?
We do have a standard rate that we've agreed on with them, but the cost will be on project by project basis.
Okay, thank you.
Before we continue, Ms. Bruneda for Public Relations, can you please reach out to Mr. Evans and have his mic be checked out, maybe offline? His mic was really distorted on my end, and I'm not sure if it's for everybody as well.
Yes,
It was on for mine also.
Okay, so, Mr. Evans, if you can just reset your microphone, it was really bad. Okay, so now we'll proceed on to Councilman Salgado. Any questions or concerns?
Yes, what I'd like to know is how much money does the city currently have in this professional services budget? And what fund does that come out of?
Are you able to hear me a little bit better, Councilwoman?
It's better, yes.
Okay, excellent. So this will be, I don't have a number on the amount we have currently in this budget line item, but it will come out of whichever specific division the work is being done. So we have kind of 4 specific divisions, which would be water distribution, production, wastewater collection, and wastewater treatment.
Okay,
all each having their own professional services line item.
Okay, doesn't our Mrs. Barrett, doesn't she have any figure on that as to an approximate amount in that budget for this particular for professional services?
I would be able to find out that number. I just don't have it immediately in front of me.
Okay.
Most of those would be tied to specific capital improvement projects. So as they get to doing those projects, that's where we know what that cost is. So at this point, I don't know.
Okay, how was this handled before, Mr. Evans?
Previously, we would either have, for large projects, for example, the SCADA project, we have a specific consultant that is doing the design. However, for projects that are more, for lack of a better word, a little bit more simple, that just require more of a kind of guidance on staff's part, staff would just kind of follow whatever was in whatever staff felt was best. If that makes sense, that kind of answers your question. This is more so that we can follow standard practices, as we don't really have any people who are in this specific discipline on staff. Does that answer your question?
Well, yes and no, but anyhow, because like Councilman Garza asked, you know, about what are we looking at dollar amount, and because it's going to be done depending on the work that they're going to be asked to perform for us, it kind of leaves it up in the air where we don't know what kind of expense we could be looking at. So, I say that's.
Mr. Evans, would those amounts be kind of set forth project by project so we would know what it would be and be able to stay within budget?
Yes, all those project amounts, just like we have other on-call services, would be approved by council, and they'd be project by project and be within a budget. So right now, for example, Jones & Carter is working with us on the SCADA project as a reviewer. They have a very specific budget to stay within. That project, their budget is coming out of the SCADA project as a whole.
Okay, but this is something, if there was a need for them, we would have a figure before they proceeded with any work, correct?
Correct, yes, ma'am.
Okay, thank you. That's all I had, Mayor, on that one.
Thank you, Councilman Salgado. Let me see. I believe I had everybody. I don't have any questions. So we'll go ahead and take a vote on ordinance 2020-094. Councilman DeRoos, in favor or opposed?
In favor.
Councilman Carranza?
In favor.
Councilwoman Salgado?
In favor.
Councilman Ojeda,
In favor.
Councilman Garza,
In favor?
Councilman Elizalde Calderon,
In favor.
and I vote in favor as well. The motion does carry. We'll now proceed on to Public Works, item 81A, Resolution 2020-056, a resolution to authorize the city manager to award a work authorization to the firm Bain Medina Bain, Inc., Engineers and Surveyors, BMB, under the master agreement for the final design of a two-lane roadway at the International Bridge. I'll go ahead and make a motion. Is there a second?
Second.
We have a motion and a second. Councilman, any questions? I'm sorry? I heard feedback. Okay, Council, I'll go ahead and ask around. Councilman Ojeda, any questions or concerns?
No, sir.
Councilman Garza?
No question.
Councilman Salgado?
Yes, please, someone, explain just so to make sure that, we're fully understanding the transfers of monies here on page 654.
Okay, yes, ma'am. This is Alberta Barrett. So basically, we're going to take 54,000 from the EDC fund, which was approved. So it'll transfer over from the EDC fund into the bridge fund. So that's where you see the 54,000 coming in as a revenue item. And then on the expense, we currently have a budget of 91,500. We're requesting to use 59, which that would bring the budget up to 150,500. And that difference, the requested amount of 59,000 would lower the increase in the fund balance to 31,000, because we're projecting that the fund balance in the bridge fund would add 90,000 revenues over expenses. So we'd use a portion of that 90,000 from the bridge fund basically to pay for this.
Okay, what's throwing me off is where you're showing the current balance for the economic development at 0. And then a remaining balance, I guess that's after you take the 54,000 from the bridge fund and into the economic development. That's where they get the 54?
Yes, ma'am. I was trying to show you that if there was 0 expense right now, but once we do the 54 transfer, then you would have an expense balance of 54,000 in the EDC fund.
Okay, and then you have the same figures for the International Bridge, where it was showing a 0 current balance.
So we'd have 0 revenue in the transfer from EDC currently. And then after we do the transfer, that's what I was trying to show you, that we'd have a balance of 54,000 in the revenue line item in the transfer from EDC. So we're showing where it's coming out of EDC going into the bridge fund.
Okay, and now from the International Bridge, you're requesting 59. Where is that 59 going to?
It's coming from, the difference will come from the bridge fund balance, because we're projecting to add the 90,000 to the fund balance from revenues over expenses. And so we use a portion of that to pay this. So the 90 minus the 59 would lead us to 31,000 that we'd use from the fund balance.
The 30 what thousand? Oh, the 31,000 you have down here. Okay.
Yes, ma'am.
Okay, I see it. Okay, thank you.
Okay.
Councilman Salgado, any other questions or concerns?
No, that was it.
Thank you. Councilman Carranza?
No questions.
Councilman DeRusse?
Negative.
Councilwoman Elizalde Calderon?
No, sir, I have none.
Okay. I'll go ahead and go around and take a vote. Councilman Salgado, in favor or opposed?
In favor.
Councilman Elizalde Calderon?
In favor.
I vote in favor. Councilman DeRusse, in favor or opposed?
In favor.
Councilman Carranza?
In favor.
Councilman Garza?
In favor?
Councilman Ojeda.
In favor.
Okay, the motion does carry. We'll now proceed on to item 8.1b, Resolution 2020-062, a resolution authorizing the submission of a solid waste grant application to the Middle Rio Grande Development Council. I'll go ahead and make a motion. Is there a second?
I'll second, Mayor.
We have a motion and a second per Councilman Elizalde Calderon. Any questions or concerns? I have none. Councilman Elizalde Calderon?
No, sir, I have none.
Councilman Giroux?
Negative.
Councilwoman Salgado?
None.
Councilman Ojeda?
No.
Councilman Garza?
No question.
Councilman Carranza?
No questions.
Okay, we'll take a vote. I vote in favor. Councilman Carranza in favor or opposed?
In favor.
Councilwoman Salgado?
In favor.
Councilman Giroux?
In favor.
Councilman Elizalde Calderon?
In favor.
Councilman Ojeda?
In favor.
Councilman Garza?
In favor.
Okay, the motion does carry. We're now on item 9.1a under fire, a resolution 2020-063, advertise for bids for a source capture exhaust system for fire stations. Is there a motion?
So moved.
Is there a second?
I'll second.
We have a motion and a second. Any questions or concerns? Councilman Ojeda?
No questions.
Councilman Giroux?
Negative.
Councilman Carranza?
None.
Councilman Garza?
No question.
Councilwoman Elizalde Calderon?
No, sir, I have none.
Councilman Salgado?
I have a quick question here, and this goes pretty much with the next, I believe the next item, but anyhow, the 12,609, where is this coming? From which fund is this being paid?
Pablo, are you there, or Alberta?
Are we talking about the advertisements on the bids, or are you on the application?
The fire exhaust systems.
Okay, I can answer that. So we're going to be awarded a grant. So we'll receive revenue of $126,089 in the general fund. And then take the total purchase of the equipment from special purpose equipment line item in the general fund for the total of $138,698. And so the difference between, once we purchase the items, then we'll submit them to FEMA to get our reimbursement of the $126,89. And so we'll have a net expense of $12,600 in the special purpose line item.
But that was not my question. My question was, it's 12,609. What fund are we getting this money from?
It's on the bottom.
It's in the fire department. I'm sorry.
Okay, because there's another similar item where, well, we'll get to it, but it's coming from a different fund.
But this item, it's on the bottom of page 101, the general fund. The account number is 542015646, special purpose equipment.
And that's within the fire department. I'm sorry.
Yes.
Okay, but you're showing a current balance in that account of zero.
Right, until we actually make the expense. And we'll make an expense, will be for the total of the item of $138,698. And so then when we receive the revenue of $126,89, we'll have a net expense or a negative of $12,609, an expense higher than our revenue. Because that'll be our share of that piece of equipment.
Right, and that's why I was asking from which fund that 12,000 was gonna be coming from. But you say it's all coming from the budget from the fire department, right?
In the general fund, yes, ma'am.
Okay, thank you.
Mhm.
Thank you, Councilman Salgado. I have no questions. We'll go ahead and take a vote. Councilman Ojeda, in favor or opposed?
In favor.
Councilman Garza?
In favor?
Councilman Carranza?
In favor?
Councilman Elizalde de Calderon?
In favor?
Councilwoman Salgado?
In favor?
Councilman DeRusse?
In favor.
And I vote in favor. City Secretary Acosta. Okay, the motion does carry. We're now on to item 10.1A, Human Resources, Information Update, Discussion of Evaluation Process for City Secretary Maria Acosta.
Mayor, I believe no, I guess it was all in there. On the previous one, no, we may have skipped something. Item, what is 2019-095?
That was an attachment from the previous agenda item. Just for your reference.
But then that's what you didn't answer when I was asking what fund. You only said that the funds that the 12,608.91 was coming from the fire department grant, and yet on this one, on page 104, it says that it's coming from the general fund reserves.
Yes, that was our previous finance director who wrote that.
So which one? So this shouldn't have even been in here then?
It was just for reference from the past agenda item. So you could see where the grant came from.
Okay, well, I just don't want to find out later on that we also pulled money from the reserves. That was all.
Okay, so again, back to the discussion of evaluation process for City Secretary Maria Acosta. Mr. Garcia?
Yes, good evening, Mayor, Council, Mr. City Manager, Mr. Wanowski. Ms. Acosta's 1 year anniversary was the first of this month. Along with that process, we have the evaluation that's needed to be done. I'll be putting it into your email first thing in the morning. I've already sent her self-evaluation, so that as soon as I get that returned back from her, I'll send it back out to all the city council. I'd appreciate it if we get it returned back as soon as possible. Possibly if we could bring it back to council at the next possible executive session that you have, and so we can move along this evaluation process. And that's pretty much it, sir.
Mr. Garcia, I think one of my concerns or questions that was brought to my attention was the fact that these are normally taken in person, and I think the question was just to ask City Secretary Acosta, are you comfortable with us, because of the current COVID situation, to convene online and have your evaluation done that way? I think it's a question that she should be able to answer, so that way council understands how she feels about it, and I'll direct City Secretary Acosta to give us that answer, so we have some direction.
Right, I'm open to it as long as we can do some kind of video conferencing. It's a little more awkward when you're just on the phone and not being able to see facial expressions. So I'm open to the video conferencing evaluation.
Okay, so with that, I'll direct the city manager to reach out to those council persons that may have challenges with the video conferencing portion, so that we can address the city secretary's Acosta's concerns for the face-to-face interview. Is that direction understood between City Manager Wanowski and City Secretary Acosta? Okay, thank you. So, council, with that being said, that covers the main concern that was brought to my attention per Human Resources through City Manager. We can definitely bring this back for the next evaluation once all those technological challenges are addressed. So I'll go ahead and put that in the form of a motion to bring back the evaluation and executive session to City Secretary with the concern addressed as far as telephonic means, so that she can see facial expressions. Is there a second?
Second.
Okay, we have a motion and a second. We'll go ahead and go around for questions or comments and concerns. Councilman Derouse, any questions or concerns?
Negative.
Councilman Carranza?
None.
Councilman Garza?
No questions.
Councilman Elizalde Calderon?
I do have a question. So I couldn't even recall when, but I thought we had done or at least I remember filling out an evaluation for her.
That was a 6 months evaluation, ma'am.
Gosh, has it been that long?
It will,
Yes, ma'am. Time's flying pretty quickly.
actually, it was a little late because of the COVID situation. It was postponed the first time it was due, and then COVID came around, and it took a couple of months. So yes, you actually did my 6-month evaluation about 2 or 3 months ago. So you are correct, Councilwoman.
It was actually
Okay, thank you.
it was actually in April, ma'am, but yes, it was just a few months ago.
Okay, thank you.
Thank you. Councilman Ojeda?
No, I don't. I don't have any questions. I would. No, I don't. I mean, whatever she's comfortable with, I'm comfortable with. I understand, the facial expressions and, I mean, whatever body language we can convey. I think we miss body language when we're not present. But if we can do video and if she feels comfortable with that, that's fine. I was thinking that whenever we would have her evaluation, it wouldn't be during a meeting, would it?
Yes, it would be during executive session, Councilman Ojeda.
Okay. All right. That's all.
Thank you, Councilman Ojeda. And I have no additional concerns. We'll go ahead and take a vote with the current motion.
Mayor, I haven't commented.
I'm sorry.
I don't have a problem, but I would also like to bring up that we're way overdue for the city manager's evaluation. We started and then we stopped because of COVID. So we need to, start thinking about that one as well.
Okay, we can discuss that during the next meeting. So right now, the current motion is to bring back City Secretary's evaluation. There was a motion and a second. I'll go ahead and vote in favor of that. Councilman Salgado, in favor or opposed?
In favor.
Councilman Carranza?
In favor.
Councilman Derouse?
In favor.
Councilman Garza?
In favor.
Councilman Elizalde Calderon?
In favor?
Councilman Ojeda?
In favor.
Okay, the motion does carry. We'll now proceed on to economic development, item 11-1A, presentation of Del Rio Economic Development Corporation semi-annual report. You know what, before we begin, let's go ahead and take a quick 5-minute break. It is currently 9:15. We'll convene at 9:20. Thank you, everybody. We are now on Economic Development Item 11-1A, presentation of Del Rio Economic Development Corporation Semi-Annual Report.
Good evening, Mayor, Council, Manager Winowski. According to the EDC bylaws, we have to give a semi-annual report, so that's what I'm doing tonight. The last semi-annual report was given for July to December 2019. So tonight would be from January to July of earlier this year or this year. So I'm going to go ahead and share my screen. Can you all see that?
No.
Yes?
No.
1 second, Ori, I just made you a presenter.
Okay, thank you. Are we good now?
Yes, there you are.
Okay. I've only done this one other time before, so I'm making sure I'm able to, okay, there we go. All right, so here's the beginning. So in January, let me just say something real quick, sorry. Give me 1 second. Having trouble seeing all of it on my screen. Okay, so in January, this is when the A&P program cohort began. The program that we have with, in conjunction with the Southwest Texas Junior College for the aircraft maintenance program. They started with a total of 10 students. And of course, this was all pre-COVID. I do believe that they are looking to expand that program to an additional 10 or 20 in total for the next semester. On January 14th, you all, as a council, passed 3 of the resolutions that are listed there. The first one was to authorize funding from the EDC to support marketing efforts for American Airlines in the amount of $40,000. The second one was resolution to authorize funding of up to $1 million from the EDC to assist with the preliminary design and construction of a 2-lane roadway at the International Bridge. You all approved that with the amendment and condition of just authorizing for the pre-design of $54,000. And then the third resolution was to authorize funding from the EDC to support the expansion of the runway at the Del Rio International Airport. And that helped towards the overall update to the airport master plan, which hopefully includes a feasibility study for potential runway expansion. Also in January was the election of the DR EDC board officers. Mr. Leo Martinez remained as the president. Mr. Eddie Amesco Jr. was elected as the new vice president. And we also have a new secretary, and that's Dr. Michelle Brown. We also joined Team Texas in conjunction with the city of Del Rio. They went half and half. And that's pretty much just a bigger marketing platform for economic development. And then later that month, on January the 18th, one of our EDC board members, Ms. Rachel Bevan, she helped organize a meeting between some of the EDC members and Representative Will Hurd, and they discussed some of the projects that were taking place, and also, you know, pretty much shared their plan or vision of hopefully having expansions there at the airport. The next slide. In February of earlier this year, the EDC approved a $5,000 grant towards workforce Middle Rio Grande industry cluster analysis. And these are just pictures from that study. I will go ahead on the next couple of slides, highlight some of the smaller language that's there. So please bear with me. This is an important project because it focuses on considerations for development of higher education. And that's a key component of any successful economic development strategic plan, is to improve or build the capacity of the workforce and to educate the current population. So it's geared towards that. Just to remind you as well, an ordinance to call special sales tax election took place. You all as a council voted to keep Type A Corporation. Let me go ahead and move to the next slide. To go back to this industry cluster analysis, these are some of the main points that it's focused on. It's focusing on the current state of higher education attainment in the Middle Rio Grande region. That was one of the components that our consultants highlighted on TIP strategies. They did state that that was an area that Del Rio needed improvement on. You know, a lot of our population is not as educated as, you know, the majority of the state. I believe only a certain percentage has, I think it's 16% or less, has a bachelor's education. And so although higher education is not necessarily the end all for everybody, it's something that is looked at when bigger industries are looking to move or expand in certain parts of Texas. The gap between the current level of attainment and the attainment goals articulated in the Texas Higher Education Coordinating Board's 60 by 30 plan. This is not just for the Middle Rio Grande area, but this is a state goal. And that brings me to bullet point 3. The strategies necessary to ensure that 60% of the citizens in the region, not just in the region, but in the state of Texas, attain some level of higher education by 2030. And then the last point, the capacity, Southwest Texas Junior College and Sul Ross State University, through their current faculties, academic programs, facilities and services in Del Rio, Eagle Pass, and Uvalde, to fulfill the strategic initiatives necessary to meet the 60 by 30 plan goals. I do want to highlight on here that with the approval of the new president of Sul Ross State University, former Representative Pete Gallego, I believe that our region will make great strides in helping to improve the academic programs and the facilities. I do know that he has always been very concerned with this part of Texas, and I have full confidence that he will work with our city in helping improve those programs as well. For the next slide, still touching upon the industry cluster analysis, they're also going to look at the current and projected population trends across the region. And they're going to develop recommendations for meeting the higher education attainment goals and the workforce development needs over the next 10 years. They're also going to look at dual credit academic and technical components for the area. I do believe that our local high school, in conjunction with the junior college, does a great job of offering dual credit programs. And so we can only hope that they continue to expand on that. And then, of course, we're also going to look at the distance between communities and campus facilities. So hopefully we do see some growth through this project, this industry cluster analysis, some growth in the education field or the workforce development field. Moving on to the next slide, March and April. You know, I don't have to remind you all, but this is when COVID pretty much hit our community hard. And so dealing with the impacts due to the funding structure and state statute, Type A EDCs are not allowed to issue small business grants. Most other Type A communities use chamber or CVB funding to help push out small business grant programs or microloan programs. And once again, I've touched upon this before, those are dangerous waters to tread. For any EDC to go into the loan business, if you will, it's just something that's not recommended in our field. So as a professional in this field, that's something that I try to steer clear from. But luckily, you all, the council, approved the small business stimulus program or grants for small business. And then, I just try to push out as much information on business loans, assistance programs as possible to both chambers of commerce's, our Main Street Program Board, our EDC board, and all other contacts that I had. We also used our social media platforms to continue to push this information out. On our website, on our COVID page, we did have a business and resource section, so we did list all of that information early on as well. And I still receive information from both the National Main Street Program, the Texas Main Street Program, and other programs. So any grant information that I get, I go ahead and push that to those agencies or entities that I've been working with. For the next slide, in May of 2020, of course, because of COVID, we had to put a hold on our marketing efforts for the air service. So we waited until the country began slowly reopening for travel. So in May, we, or the EDC, approved the hiring of a Fly DRT marketing representative to help promote air service as the country began slowly reopening. And the individual that was hired was Ms. Lupita Castillo. He also worked for our public relations division in the past. She left us because, she took maternity leave. So we were able to hire her on as a contract worker using some of the funds dedicated for air service marketing. And then this past month in June was the kickoff meeting for the planning committee for the airport master plan update. It was a very successful meeting. It was an online virtual meeting. I was able to take part in it in addition to about another 15 or 16 individuals. We did have some representation from the EDC, and those representatives were Dr. Michelle Brown, Ms. Rachel Bevan, and Mr. Mark Brown. They were able to complete a SWOT analysis. It's very common in the industry, and I did attach that SWOT analysis in this packet just for your reference. And our next kickoff meeting, or I believe late August, early September. Initially, they wanted to do at the Civic Center, but because of everything that's going on, it's most likely going to be held virtually again. And that's about it. I do want to state that even though it's not part of, July is not part of the semi-annual report, we do have a major project in the pipeline. I was able to communicate with a company that we're looking to execute a performance agreement with. And I do hope to bring that before the EDC board in early August, and then again, hopefully for you all's approval in late August. This is a major project that does include job creation, so I'm hoping, that it goes through and everything is successful and we get to see more jobs here in Del Rio. And the EDC, on behalf of the EDC and myself, thank you all for your continued support. If you have any questions, I'm happy to answer those at this time.
Council Sachi mentioned if there's any questions or concerns. Councilman Salgado, any comments or concerns regarding the presentation?
I have a question regarding this approved hiring of for a marketing representative. I don't recall that coming before the council.
Ma'am, according to our bylaws, you all already approved the funding through the resolution, the $40,000 towards marketing.
Okay, so the $40,000 had not been spent.
Exactly. So part of her salary is being funded through that $40,000, and she's working strictly part-time contract. The EDC did agree to, after her 6-month period, they would review and see if they would want to keep her or not.
Okay, I'll wait until the others have commented, because depending on what questions they have, I may be asking something else.
Okay.
Councilman Carranza?
No, I have no questions.
Councilman Ojeda?
No, none.
Councilman Garza?
No questions.
Councilman DeRuz?
Negative.
Councilwoman Elizalde Calderon?
No, sir, I have none.
Thank you. Councilman Salgado, did you any other questions before we move on?
Yes, as a matter of fact, the other information you provided us with Ori on page 122, I have several, but I'm going to limit them. On page 122, as far as future projects under formal review, then going down to item number 3 or number 2, where I guess one of your goals is a joint project with the county considering funding a new master plan for street and infrastructure growth to support city expansion. Well, you folks yourselves have said, and you know that that there is no land to expand to, and I have been singing that song for over 40 years. What exactly, or what do you folks have in mind, or is this something you'll be bringing back at a later date? Because right along with that, you talk about a 4th industrial park, but is this industrial park, is it something that's going to be located in the city? Because it seems like with the A corporation, the city has nothing that that they can benefit from with an A corporation. But that's what we have. But this is what I'm asking: what you know, what is the economic development's thoughts on where they would like to see a 4th industrial park?
These are all just pretty much wish list type projects that they're considering for the future. These are not necessarily projects in the immediate future. These were collectively put on this list or on this goals and objectives working document, if you will, as some of the goals that the EDC board has. So this is something that, you know, I can honestly tell you, just depending on funding, depending on the project I alluded to earlier that we have in the pipeline, some of these, you know, are not probably going to even be considered until another, you know, year or two. I cannot answer the question in terms of where exactly is going to be the 4th industrial park. I do understand your concerns with, you know, the property being out of city limits. Of course, if a project was ever undertaken that dealt with the county limits or in county properties, then we would have to, or I would have to go before the Commissioner's Court for their approval. That's just part of state statute on anything that's done with EDC funding. So just to remind you on that. But these are just, like I said, these are future projects. They're kind of wish list type items, and they're not actually working projects right now. The ones that are working are the ones that I've already touched upon, that you all have already formally approved resolutions on.
Okay, well, that's why I thought I keep it short on that, just to try and get some feeling as to what was a plan for this other information you had here, because I know that with you folks starting to do more pushing on the airline, I haven't seen not much of an improvement there. If anything, it's been low, and I just don't know what the future holds for it. And we have not been made aware of anything. I don't know if anybody else on the council has any info on that, but I know I, for one, have not heard anything about it. And people out there are asking if they're going to have to cough up more money to keep it going, and they're not happy about it.
I just want to, you know, emphasize a point. We're the support that the EDC has on it is less than 10% of their sales tax collection. So I want to make that clear.
No, I understand the EDC's portion is very low, but the city's portion was very high, so, but that has nothing to do with that. So those are all the questions I have for you. Thank you.
You're welcome, ma'am.
Okay, thank you, Councilman Salgado. And that was everybody's feedback and questions regarding that update. This was just a presentation. We'll now proceed on to item 11.2A, Resolution 2020-057, a resolution to execute a memorandum of understanding by and between the City of Del Rio and the International Food Bank in support of the Outreach and Distribution Program. I'll go ahead and make a motion. Is there a second?
Second.
A motion and a second. Any questions or concerns? Councilman Ojeda?
So would this be, one sec. No, I don't have any.
Councilman Garza, any questions or concerns?
No.
Councilwoman Elizalde Calderon?
No, sir, I have none.
Councilman Giroux?
Negative.
Councilman Carranza?
None.
Councilwoman Salgado?
No.
Okay, and I have no further questions. We'll take a vote. I vote in favor. Councilman Garza, in favor or opposed?
In favor.
Councilwoman Elizalde Calderon?
In favor?
Councilman Salgado?
In favor?
Councilman Carranza?
In favor.
Councilman Giroux?
In favor. Councilman
Ojeda?
In favor.
The motion does carry. We'll now proceed on to item 12.1A, Ordinance 2020-095, an ordinance authorizing the city manager to sign an agreement for collection of taxes between the City of Del Rio and Valverde County. I'll go ahead and make a motion. Is there a second?
Okay.
We have a motion and a second. Questions or concerns? Councilwoman Elizalde Calderon?
No, sir, I have none.
Councilman Garza?
No question.
Councilwoman Salgado?
Yes, I have some questions. I'd like to know, maybe Mr. Winowski can, should be able to answer these for me. Was this position ever posted or advertised?
What position are you referring to?
The tax collector.
No, it was not. After it was vacant, we did not post or advertise.
So what is the intention as far as the department?
As it's the recommendation that we go into an agreement with Valverde County to oversee those services which we currently provide.
Well, the thing is that it is my understanding, and correct me if I'm wrong, but only the council can create or abolish a department, and it seems like all of this was done without being brought to the council first to get some feedback from the council. The fact that I know that the last time before the last tax collector, there was advertised and there were people that applied for the position.
Yeah, I don't know what happened in the past, but that's why we're bringing this forward to council for their feedback. We see benefits in customers going to one place. Imagine just going to one place to pay your property taxes rather than go to different entities. And we saw it as a win-win, and just presenting that to you. You guys can vote to approve it or deny it, and we'll go forward either way.
Yeah, well, when you say that you don't know what happened in the past, you were there when the previous tax collector was let go, and it was prior to her coming on the job, or just about that time, that we had several applications, because I was approached by someone who was asking me if I knew the status of what was going on, and this was, of course, after I don't want to mention names, after the last tax collector was let go. And I told him that somebody had already been put in place. It was somebody who was already working for the city. But like I say, I don't know why it is that things get done without, certain things get done without prior council approval. And like I say, because this seems like you're doing away with that department. That's how it sounds to me.
That our recommendation is to contract with the county, and we were exploring options and wanted to bring this recommendation to the council for your consideration. No other further action has been done.
Well, I just wish, like I said, that something would have come before the council sometime back, because here we know that we're in a pinch. Well, we know we need someone in there, but we have plenty of time to have been able to hopefully work something out and then use this as the last option. But I'd like to exactly how much money are we saving? Or are we saving anything? I know you have a chart here, but they're depending on whether that department remains open. And this is why we need to know, is that department closing down completely? Is that going to be the will of the council to do away with this department? Is that what we're doing?
That's staff's recommendation. You guys vote and tell us what you guys want to do. We're not going to do anything you don't. And to answer your question, it is basically a wash, but I think the benefit to the customers and having one place to do that would be beneficial to them. In addition, it would free up office space at City Hall. And there we show kind of the pros and the cons on our recommendation for you guys to review.
Yes, and I saw that, and it all figures out anywhere from $427,000 to $475,000. But like I say, it would be nice to know beforehand what's going to be thrown at us.
I did inform the council in an email and also on a project progress report that we were looking at different options and avenues. April 29th was the first email, and then the project's progress report was on May 29th that we were exploring options. And we have this agenda item here now. Again, it's not the last resort. We do have other options besides what's being presented. This is just what our review has been done and what our recommendation for council to consider at this time.
Well, I feel that the council should have been given all of the options and that it should have been discussed, but it wasn't, and we're at the point where now it's going to be up to the council, whatever the council decides.
Thank you, Councilman Salgado, for your feedback. We'll now proceed on to the next council person, Councilman DeRusse. Any questions or concerns?
Negative.
Councilman Carranza.
Mr. Winowski, just a question. If we agree to do this, the other employees that are there still in that department, what will happen with them?
So the county has agreed to take one of them, and we would do our best to find a spot for one of them here in the city as best we can, so that they're not having to worry about losing a job.
Okay, so, but you're not saying then that you have a spot for them already? There's no guarantee?
And this will come effect October 1st, and so depending on what the council decides, we would be able to find an area for that to work out.
Yeah, I mean, I think this makes business sense, but I just, my concern is that I don't want anybody in that department to be, I don't want to put anybody out of a job as far as that goes in that department. So,
yeah, we don't want to either.
Okay, just that's all I had.
Thank you, Councilman Carranza. Councilman Ojeda.
No, I just, I'm just looking at the cons, and there's 3 of them. The second one, assist tax collector assessor will require approximately 3 years training to obtain certification for tax assessor collector. Why is that there? I don't understand. To approximately 3 years of training, I don't understand that part.
Alberta, can you speak to that a little?
Yes, thank you, Mayor and Council. I just wanted to point out that our tax assessor collector did a very good job. There's no problems there, but to be able to become a tax assessor collector, she still has certifications that's going to take her about 3 years to obtain. So it's not like we could wait, a couple months and she would have. Unfortunately, it's longer time.
Okay, now I see where you're coming from now. This would be a con if we were to put one on. If we were to continue with one, is that it?
Yeah, you kind of cut out. So you think it's a con? What were you saying? Because of the time frame?
Yeah, if we were to stay on with one, this would be a con.
Right. It's not like I have somebody that I could just move her into that position right away because she doesn't have the certification. So.
Okay. I understand now. Thank you.
Uh-huh.
Thank you, Councilman Ojeda, and I have no additional questions. We're going to take a vote.
Mayor, before you do, I found a couple of other things I'd like to ask.
Go ahead.
Okay, my other questions were, you indicate the bond, I believe, considerably less than what our charter requires. Our charter requires a bond of $200,000, where I believe the county, it says the bond shall be payable to the city, shall be in the sum of $50,000. We would be doing this in direct conflict with what our charter calls for. That is one thing. And so I'm not hearing anything.
I wasn't sure. I know that if we have them employed with the city, then we have a bond on them at $200,000.
But the charter doesn't address anything else, so maybe we better check into that before we commit to it. And then, because the county is going to be responsible for providing that bond.
Yes, ma'am.
And the other thing is,
can I pipe in real quick? Just so everybody understands that bond, if the county buys the bond, that's beneficial to the county. As far as the city goes, if somebody mishandles our money, they owe us the full amount of money. So the bond, if it's low, that's just what the county says they have to provide. But if a county employee didn't, like I said, mishandled the money, the county would still be liable for the full amount. So I think you're making a good point that it might need to be higher, but that is for so when we have a $200,000 bond, that's so that a surety bond company pays us if our employee mishandles money. But in this case, it would be for the county's benefit to have a higher number if they so chose. Does that make sense?
Well, it makes sense. My only concern is if they say, well, our bond is only, for $50,000 and that's all we're paying. We just need to look ahead and make sure that we're covered from all angles.
Yep, that's a good point, ma'am. I just wanted to make sure. Okay.
Okay. Now, another question I have is that the county, that they will be the ones that will employ legal counsel for the collection of the city's delinquent taxes. We just went through that here a meeting or 2 meetings ago, where you're advertising for an agency to apply to collect our delinquent taxes. So what exactly are we doing here?
We're being prepared in case the council votes not to do it.
The what? I'm sorry, you broke off.
We're being prepared in case the council votes not to do this.
But we were never told that all of this was going to happen or that this is the way that it was definitely or that you had, because I get the impression that this has already all been worked out, the numbers and all of that, what the county will get. And it just seems to be getting, taking more and more control away from the city, from the council, as to how things operate in the city. That's the impression I'm getting.
This is simply an option for the council to consider. Nothing else has been done.
Well, this is why I'm bringing them up, so that we can all be fully aware.
Councilman Salgado, any other questions or concerns?
I'm just looking at this other page real quick, if I may. Okay, another item to take into account is on page 141, that the county shall not be liable to the city for any failure by the county to collect any tax penalty or interest under any provision of this agreement. So there's some things here that we better take a good hard look at. And that's all I have for now on this. But I would like, hopefully somebody can answer.
City Manager Wanowski, did you want to comment to that last statement? You're muted.
Sorry, we did have the city attorney review this document, and we can review it a second time with the points noted.
Thank you, City Manager Wanowski. That concludes all the questions and comments. We'll go ahead and take a vote. We'll go ahead and vote. I vote in favor of Ordinance 2020-0995. Councilman Garza, in favor or opposed?
In favor.
Councilwoman Elizabeth de Calderon?
In favor.
Councilwoman Carranza?
In favor.
Councilman Ojeda?
In favor.
Councilwoman Salgado?
Opposed?
Councilman DeRuse?
In favor.
Okay, the motion does carry. We'll now proceed on to City Secretary Ordinance 131A 2020-096. An ordinance in accordance with the Del Rio City Charter and state law ordering and establishing a date for holding and conducting a regular election in and throughout the city of Del Rio for the purpose of electing persons to hold the office of Councilperson at Large Place A, Councilperson at Large Place B, Councilperson District 3, providing for the appointment of election judges, fixing the maximum number of election clerks, and establishing the rate of pay for all election officers, providing for the designation and location of municipal election precincts and polling places, providing for the public notices of said election, establishing a date for holding a runoff election if required, and containing an effective date. And I do believe the city secretary has an update, as the governor has announced some date changes regarding the election early voting.
That is correct. I did send an email letting you know that the government did issue a declaration extending early voting, which means that we have an extra week of early voting, which means we'll have additional salaries to pay. Now, there is a high possibility that the state will reimburse us for the expenses of the election, but that is not I can't guarantee that. We are keeping, we're anticipating that they may possibly happen. So early voting will begin on October 13th versus October 19th. And this ordinance was previously presented to you back in February. We've made the changes to the dates. The other change that may take place is that based on the lack of election workers that are willing to work during the pandemic is making it a struggle to have polling places in every precinct as we normally do. There may be a possibility that polling locations may be consolidated as best as possible to meet the community's needs. So as those changes take place, we will bring that to your attention.
Thank you, City Secretary Acosta, for that information. We'll go ahead and, is there a motion on the table? I'll go ahead and make a motion for Ordinance 2020-096, and then we can also bring it back before a discussion before voting. So there's currently a motion. Is there a second?
I'll second.
Okay, we have a motion and a second. I'll let City Secretary Acosta decide which second. Okay, so council, any questions or concerns? Councilwoman Elizalde de Calderon, any questions or concerns regarding ordinance 2020-096?
No, sir, I have none.
Councilman Ojeda?
No, I do not.
Councilman Carranza?
No questions.
Councilman Garza?
No question?
Councilman DeRose?
Yes, City Secretary, thanks for addressing those questions I had about, getting workers and that kind of thing. So my follow-on question is, if we do have to maybe just use the Civic Center due to the number of workers, how far out is there a requirement? How far out will we need to publicize that so to make sure people know that it's not going to be, their usual voting location?
I don't have an answer for that. We were told that the governor will be, for us to expect more changes to come. But that will be a good question to ask, and I will try and get back to you as soon as possible on that information.
Okay. The other question about the election day voting locations, on a typical, national election in November, we have a lot more locations throughout the city. But those normal ones, like the one that we would normally vote at on day of is, over at Kingsway and Amistad. That's not listed here. So based on that, if I don't early vote, would I need to go vote in two separate locations on election day?
No, it will still be, they'll still be by precinct, by your local designated precinct.
Yes, but what I'm saying is, on a normal national election in November, my voting location is just down the street on Kingsway. But that is not listed on the voting locations for election day. So if I vote on election day, would I have to vote at my normal location for the national races, Congressional District 23 and the president and all that, and then I would need to go to somewhere else for the local election?
No, they will all be in the same location based on the precinct that is listed on your voter registration card. So you will not have to go to more than one location.
Okay, so these polling locations that are listed, do they really apply anymore? The three, the City Hall for District 1, Civic Center District 2, and San Felipe Middle School for District 3. Do those still apply?
No, they will not apply.
Okay, so we would need to change that paragraph.
Correct. I thought we did, but I may have missed it. I do apologize.
I'm looking at the most recent one I think I'm looking at the most recent one that you emailed out with the change of dates.
So the following paragraph, after listing those locations, it does state that the polling locations are subject to change in accordance with the general election for the state and county officers.
Okay, so I would question whether or not we want to put that in there right now.
Correct. And the reason we put that in,
that those aren't going to be the only locations.
Correct. The reason we left those locations in there is that is what is listed in our code of ordinances. That is in our municipal codes. So in our charter, actually.
Okay. Well,
so we wanted to designate that, we will still accommodate. We will make sure to accommodate all the community in those locations that we have listed. We will make them as convenient as possible to those original locations.
Okay, well, that goes along, with what I was saying about the change in dates and times and locations. If we don't get poll workers, we just need to publicize that as far out as we can. Once we figure that out.
Correct.
That could be very, very confusing. You know, we've had it here in town before where, you know, on our May election date, people had to go to 2 different locations to vote. And,
Right, definitely.
you know, we need to eliminate that. So
Correct.
that's all I have.
And-
Thank you.
Yes, and that does affect, you know, both the school district and the hospital. We're all in the same situation, but we're going to do our best as possible to get the information out as soon as possible.
Thank you.
I believe that was everybody, correct? As far as
No.
this order?
No,
Okay, go ahead.
I have some questions. Mr. Costa, on the, as far as the funds, I see where you have 15,000 as your current balance. And we know that it's going to be considerably more than that for the election, right?
Yes, and so the budget that you see now was the original budget for the October, for this current fiscal year. So
For the May election.
correct. So this election, the November election will actually hit the next fiscal year budget, and we've already made accommodations for that.
Okay. Okay, so it'll be budgeted in this coming budget.
Correct.
Right? Okay.
Yes.
Now, my other question, and maybe to help out with maybe some of Jim's questions here. Now, has the county clerk indicated whether she's consolidating precincts or if she's having all of the precincts?
She is considering consolidating precincts. We, the school district, the hospital, and myself are to give her some recommendations based on the locations that we have now. She would like us to let her know which ones are the most important for us to keep. And we're going to base it on the number of voters that come out.
Okay, because I was just wondering if she's consolidating, then it won't be as spread out as other times, so it won't be that big an inconvenience. Or hopefully, some people will be inconvenienced, but you know, when you consolidate, that's what you have to do. And hopefully we'll be able to get most of the city to do just a one-time voting, one place voting. So
right, and we're hoping that by extending the early voting, you know, we'll get more people to come out during that time.
Yeah, I sure hope so. Now, on the election judges, the charter calls for the city to select election judges and election precincts and all that, but because of the contract with the city, now there's nothing in the charter that addresses that, but the least that we should be able to do is to approve, which also calls for in the charter, the election judges, the early ballot board, as well as the polling precincts. Now that should be coming back to us here pretty soon, right?
Yes, as soon as I have that information from the county clerk, I will present that to council.
Okay, and let me just real quickly make sure I don't have anything else. No, that's it on your portion. I may have a couple of questions on some of the measures that are going to be on the ballot. Can we address those now, or?
That would need to come back as a separate line item for the agenda, ma'am.
Okay, because they were included here. I just wanted to make sure, because I do have some questions.
If we're talking, are you talking the charter amendments?
Yes.
Okay, so Mayor Lozano, if you want to bring it back again, you can. I'm not sure when they're going to order ballots, but what she's talking about is all the charter amendments. So it's posted and it's in the ordinance.
Sure, then if that's the case, then we can go ahead and open up that discussion portion if it's posted as is. Go ahead, Councilman Salgado.
Okay. Let me make sure I have done. One of the changes is on page 157, one of my questions, and it has to do, let's see, measure B, hold on a second. Because there's quite a bit on it, and because there they're shrunk down, maybe I'm reading more into it than I should, but, on measure A, of all the stuff that's crossed off, on page 157, item B, it has to do with franchises. Now, is that going to be covered under one of the measures? Or under one of the propositions? Because we have quite a few of them.
I'm sorry, can you say that again, Councilwoman Salgado?
Okay, on one of the propositions, Proposition A, where it says the amendment of the city charter of the city of Del Rio to revise and delete sections which are inconsistent or outdated under state law to be consistent and all that. Under that, I guess the only things you are referring to is just everything that's scratched off, but everything that, everything else that's there will remain. Am I reading that correctly?
Yes, ma'am, that's the intent. And so the franchise one in particular, those details aren't required by state law. So the idea was to pull those out and just say, to grant, amend, renew, or extend franchise, follow any provisions set by state law.
Okay,
But I don't know if you guys remember when we talked about it before, this is your language, so we can change it if you want. That's just the intent of what's there.
okay. Now, on measure E, on the language here, that was crossed off, on section, excuse me, on section 127, the city council may establish either a department or office of city planning. In either case, the city manager shall appoint a director of planning with approval of the city council, who shall answer directly to him. I don't recall, I don't know what others recall, but I don't recall that that it did not need council approval.
We did talk about this last spring. This is what the council voted for, but again, if that's not what you want, you can change it. The charter does call for the planner to be directly under the city manager, and there is value to that. We haven't had the planner in that position in the actual org chart in many years, not since I've been here, and I think probably not a little bit before that as well. But Mr. Winowski can probably speak to you more about why he's requesting that.
Okay, well, it's never been, as far as I know, while I've been there, where the city planner is under the city council, but that's a head of a department.
No, I'm not. This doesn't move them to under council. This moves the planner to basically what the charter right now says is the planner is supposed to report directly to the city manager. So this would take out that requirement. So it would be like any other employee that could be moved around in the org chart.
Okay, but here, like I said, the only thing that it said was that it, that it would, what you're scratching off is the portion that says, with approval of the city council, who shall answer directly to him. So what I'm reading here is that you can appoint whoever you want the planner without approval of the city council. That's what I'm reading here.
That's right. It's not a department head position now, and as Suzanne said, I guess it hasn't been, directly under the city manager since she's been here. So this would just clarify that this isn't a department head position that would need council approval.
Okay. And I
So
think that,
Claire,
go
this is
ahead.
not my recommendation of what I think this ought to be. This is just the redo of what you guys discussed last spring. And then if there was a time when the planning director was a director like a department head, it would fall under the other rule that requires the department head to be approved by council. So if that position in the city had that level of authority, then it would need council approval.
Okay. Well, I just want to make sure because I understood it to be head of a department.
With the way she sits right now, that position is what we would call a division head.
Yes, and that's why I was confused about this thing, and because as far as I know, all division heads need council approval, correct?
Well, division head is the layer below. So department head are the ones that need council confirmation, and then the layers below are the division heads. So Janice, Tony, Danny, Roger, those people who are the ones below the department heads, those are what we term division heads. That's what the planning position is at right now.
Okay, maybe what would be good, Mr. Winowski, would be helpful if when you have a few minutes, if you would provide me or us, if the other council members want the information. I know I want as much information as I can get, but maybe indicate who the division heads are, who the department heads are, so that way we know exactly, what we're dealing with.
Sure, I can resend the last council item where we changed the org chart that shows who department heads are, and then also add the division heads as well.
Okay, because we've had a couple of those, and at this point, I don't know what's what in that area. Thank you.
Thank you, Councilwoman Salgado. Any other questions or concerns, Councilwoman, before we take a vote? I hear none, so we're going to take a vote. All those in favor of ordinance 2020-096, I vote in favor. Councilman Ojeda, in favor or opposed?
In favor.
Councilman DeRuse?
In favor.
Councilman Garza?
In favor.
Councilwoman Elizalde Calderon?
In favor.
Councilwoman Salgado?
In favor.
Councilman Carranza?
In favor.
Okay, the motion does carry. Now we're on to item 14-1A, ordinance 2020-090, an ordinance authorizing a lease agreement for placing an ATM at the Del Rio International Airport. I'll go ahead and make a motion. Is there a second?
Second.
We have a second. Any questions or concerns? Councilwoman Salgado?
Yes, what was the reason that did the two local banks indicate a reason why they were not interested in providing these ATM machines at the airport?
No, ma'am. The one that responded told me that they had a shortage of equipment, so the places where they locate their machines were very selected, and that they will put it in the list in case that they will have any machine, but that has been over a year and no communication from them.
Okay, thank you.
Thank you, Councilman Salgado. Councilman Garza, any questions or concerns?
No.
Councilman Elizalde Calderon?
No, sir.
Councilman Ojeda?
No.
Councilman DeRuse?
Negative.
Councilman Carranza?
None.
Okay, we'll take a vote. Councilman Carranza, in favor or opposed?
In favor.
Councilwoman Salgado?
In favor.
Councilman DeRuse?
In favor.
Councilman Ojeda?
In favor.
Councilman Garza?
In favor.
Councilman Elizalde Calderon?
In favor.
Okay, we're now on the consent agenda item 15A, the approval of meeting
Mayor?
minutes.
Mayor,
Yes,
can
ma'am.
you vote, please?
Oh, I'm sorry. I vote in favor.
Thank you.
Thank you. So the motion does carry. We're now on the consent agenda item 15A, the approval of meeting minutes, and item 15B, ordinance 2020-092, an ordinance to accept a contract agreement between the City of Del Rio Transportation Department and Valverde Nursing and Rehabilitation. Council, is there any item you would like to discuss before we take a motion?
Yes, I have on the minutes, and let me real quickly check the others. There was on another one, I have another one also. Just give me a second here. No, I believe it was just on the minutes, a couple of minor corrections. Mayor?
Yes, ma'am. We're
It
waiting
was
for
just
your.
Oh,
concerns
okay.
here.
I didn't know. Okay, on the first one, the June 30th meetings in page 182, item 3A, on the second paragraph, on the first sentence, at the end of the first sentence, was the city manager Wanowski closed. Should "the" be there? The word "the"?
No, it shouldn't.
Okay, then we can go to page 180, no, that was okay. Page 187. About halfway down the page where you have the bullet points. On the sixth bullet point, on the middle sentence where it starts unauthorized vehicle use in parks, it goes on to say 3 curfew violations, 3 misconduct. We need a correction, I believe, on misconduct.
Noted, thank you.
Then page 192, the fourth line up from the bottom towards the end of that sentence, where it says previously requested, or should that be requested?
I'm sorry, can you repeat where that one's located?
It's the fourth line from the bottom on page 192, the word request. Should that be requested?
Correct. Yes, ma'am.
Okay, then page 193, it would be, let's see, would be on the second paragraph where it starts out with Councilwoman Salgado. You have Councilwomen, I hadn't caught that before, but when I'm looking at it, it should be Councilwoman. Anyway, almost towards the end of the sentence, it has residence where it should be precedence.
Correct. Noted.
And that's it on that.
Thank you, ma'am.
Thank you.
Thank you, Councilwoman Salgado. So are there any other council members that have any questions or concerns before we take a motion to vote on the consent agenda items? Okay, I hear
Mayor.
none.
No, I do. Can we vote on those separate? Because I will have to abstain from voting on one of them.
Okay, we can do that. So I'll go ahead and make a motion to approve, or to make a motion to approve the meetings as stated with the corrections for item 15A. All those in favor? I vote in favor. Councilman Ojeda?
Mayor, we need a second.
I'm sorry, we need a second. So is there a second?
I'll second.
Okay, we do have a motion and a second. Councilman DeRuse made the second. So Councilman Ojeda, in favor or opposed?
I'm in favor.
Councilman Garza?
In favor.
Councilman Carranza?
In favor.
Councilman DeRuse?
In favor.
Councilman Elizalde Calderon?
In favor.
Councilwoman Salgado?
In favor?
Okay, now consent agenda item 15B, ordinance 2020-092. Is there a motion to approve ordinance 2020-092?
I so move.
And I'll second. Go and take a vote. Councilman Elizalde Calderon?
Mayor, I will abstain from voting on this item.
Thank you.
Out of an abundance of caution, I am abstaining, pursuant to Chapter 176 of the Local Government Code.
Thank you. Councilwoman Salgado, in favor or opposed?
In favor?
Councilman Carranza?
In favor.
Councilman Garza?
In favor.
Councilman Ojeda,
In favor.
Councilman DeRusse.
In favor.
And I vote in favor, so the motion does carry. Thank you, council. We're now on to item 16, citizens' comments. It's my understanding that nobody signed up. We're now on item 17.1, executive session and matters covered by section 551.074 of chapter 551, Texas Government Code, discussion of personal matters for city attorney. Council, at this time, I would like to go ahead and make the motion for, because of the current time right now, that council brings their top 2 candidates out of the packet that was given to us. We deliver it to via electronic means or telephonic means to the city manager, and then we can bring back, so that way they can at least begin the interview process, and we can discuss the interview process with those top 2 candidates at a later date. So I'm going to make that motion. Is there a second to bring your top 2 candidates? Okay, let me just repeat the motion. So to bring the top 2 candidates for the city manager's attention as far as the candidates go from your packets that was received, and then we'll bring that item back to the next council meeting, the next regularly scheduled council meeting for August 11th to go with those 2 persons for interview process. So there is a motion, there's a second. Any questions or concerns before we take a vote? Councilman DeRusse?
Negative.
Councilman Carranza?
None.
Councilwoman Salgado?
No.
Councilwoman Elizalde de Calderon?
None.
Councilman Garza?
No questions.
Councilman Ojeda?
None.
And I have no further questions. I vote in favor. Councilman DeRusse?
In favor.
Councilman Carranza?
In favor.
Councilwoman Salgado?
In favor.
Councilman Elizalde de Calderon?
In favor.
Councilman Garza?
In favor.
Councilman Ojeda?
In favor.
Okay, the motion does carry. City Manager Winowski, you understand the direction and the motion, correct? Okay, thank you. So be sure, council colleagues, if you could please give that information by end of day tomorrow so that he can get started on giving those persons a call. Thank you. We'll now proceed on to the adjournment of this meeting. It is now 10:27. I move to adjourn. Is there a second?
Second.
Okay, we move to adjourn at 10:27. We are now concluded. Everybody, thank you for a great meeting and have a great night.
Right.